Is he? We're going down. Y'all ready for this? Ready as you can be, huh?
Yeah.
Okay, good.
Yeah, just so you know, there's some language that I'm gonna ask to introduce into this contract tonight, so we'll take it where it goes. Exactly. So, yeah,
So, how's your
it just bothered me. Yeah.
But they can put me.
All right, why don't we go ahead and get started with our work session? We'd like to welcome everybody out with us this evening, and for the next hour or so, we're going to have a presentation by our Fire Chief, Jeff Jarrow, and talking about the inter-facility agreement, and he's going to spend some time explaining that to us. And then what I'd like to do is give Zach an opportunity to give us a recount of heydays and kind of how things went there and some of the good things that happened, and then we'll review the agenda. And so with that, I'll call the meeting to order, and we'll turn the time over to Jeff and give you the time to talk about this agreement, and then it'll allow for some time from the council to ask questions and comments.
All right, thank you. How's everybody doing? Good, hopefully. All right, so I appreciate the time to come and talk to you guys about a contract, opening a discussion on a contract, potential contract with IHC or Bear River Valley Hospital for the transfers. I know this has been a pretty big issue for us and a big topic for conversation. So I'd like to to do this to help for a few different purposes. One, clear the air, get everybody on the same page so we can understand kind of what we're looking at with the transfers. And then two, help show some possibilities for potential revenue to help the city with the fire department and staffing and things like that. So, and again, just so we're all on the same page, this is an idea. This is potentiality, right? This isn't something that's set in stone. I haven't met with the hospital and settled on a contract. The contract that I've drawn up is just a draft. And so, Cynthia, I don't know if you have the slideshow, if you could put that up, please. Thank you. So this is kind of a needs assessment as well as a presentation on the benefits that could come from this contract, potential contract. You can just skip right to slide 2 if you want. Okay, there you go, perfect. So, so the numbers that you guys have in your little notes are a little bit off here. It says 2,000 calls, and we actually have about 1,800 calls and 357 interfacility transfers, which is about 20% of our call volume that we run throughout the year, which would include fire and EMS calls. And so we kind of pull out of the EMS this 20%, and which is not as much as we initially would have thought it would have been out of our total call volume. But it does add some call volume. And so just some basic numbers. We have about 35 personnel, full-time, part-time. 9 are full-time. Out of those 9, 3 are paramedics, and that's 1 per shift. We have an A, B, and C shift. And so, we have 4 people on staff 24/7. So 1 of those are paramedic, and the other 3 are EMTs. And so 3 out of the 4 are full-time. They're here 24/7, and then the other person is a part-timer. And so with those 4, state law requires that we have 2 EMTs on the ambulance at all times for various reasons. One of those being patient care is the main reason, right? And so as we get into this, we'll talk a little bit more about some other standards like NFPA 1710, which requires we have 4-man engine company, which we meet until we go out on the transfer or 911 call, and we split our crew into 2 different groups. And so if you go to the next slide, Cynthia. Again, we have 357 transfers. At any given time, these calls can come in. There's no rhyme or reason to it. It's just like 911 calls. They come in any moment whenever the hospital decides to send those out. And it could take anywhere from 2 to 3 people, depending on the level of transfer that it is. Basic level call requires one person in the back, one person driving. Something that's more advanced will require a paramedic in the back as well as an EMT to attend to the patient in the back. Could take anywhere from 3 to 3.5 hours per call, depending on the distance. You go to the next slide, please. And so just looking at the numbers and locations of where we go, McCady Hospital is probably the most frequented that we go to. Out of those 357 times we've gone on a transfer last year, 137 of those were to McCady Hospital. And so you have 44 miles one way to get there. We don't get paid round trip. We only get paid on the way there. That takes round trip to about 2 hours and 15 minutes. That's getting in there pretty quick, dropping them off, giving a report to the hospital on what's going on with the patient, and then getting back out, cleaning up the stretcher so it's ready to go for the next call, and then driving back. So on average, we're taking, again, you see Logan's 27 miles, takes about an hour, 40 minutes to an hour one way, and then turn around and come back. So you're about 2 hours there with the drop off. And then Provo is another one that we've gone to quite a bit, and that's 117 miles, hour and 45 minutes. So you guys can see here, it's taking our people out of the city and a resource out of the city for quite a long time for these transfers. Can you go to the next slide? That's taxing our citizens. The big deal here, time-wise, is what do we do if something happens where we get a cardiac arrest in our city? Now we're down 2 people, and we're relying on other cities around us that are volunteer to come in and help us with those calls. And we do that for them, but we're relying on that for our citizens. So in 2024, 200 of these calls, we had of our call volume was 11%, which is a little bit less than it is now, so that number has gone up, right? And then you can see this year we've had 270, so it's gone up about 30%. And then down further in 23, we had 1,598 calls total, and then in 24 we had 1,700 calls total. And so this year we're on track to get closer to that 1,600 call mark, or probably exceed that. We're currently in the 900s right now. So next slide. Thank you. So you can see the trend here on the numbers. You just kind of flip to the next one real quick. And again, this is our age group. So here's where we kind of see the rubber meeting the road. 65 and older, these patients are on Medicaid, Medicare, or they're self-pay. They're on a fixed income. And so if we want to help protect our citizens, instead of having them get a bill on the way to the hospital from their home, and then get billed by the hospital again, and then get another bill from us on the way from between hospitals, if part of doing this contract would help clarify some of the nuances and the ground level stuff with our behind the scenes stuff as far as protocols and things like that with the transfer between us and the hospital. And then the other part of that would be securing revenue. These are, if you go to the next slide, actually skip 2, sorry, one more. That's time of day and then day of the week. It's pretty sporadic. If you can go down to the next one, sorry. So it's difficult. We'll come back to that slide in here in a second. So it's difficult to collect on those calls. And so again, just reiterating, the personnel, we're 24/7. We're taking 2 of those people away, and we're running a risk of having a catastrophic event and only having 2 people or less here at times in the station. Some of the things that have come out of our staffing being increased from volunteer or part-time to full-time, if you look at our call volume, our call times, have increased or decreased. We went from 6 minutes on average responsive time from dispatch to en route to 3 minutes, 3.5 minutes to dispatch to en route time. So we had a 41% increase with having full-time staff. We have had some misfortunes with filling part-time shifts. It's also made it a little bit difficult to respond to transfers. We've had 28 open days, basically, where we haven't had a full staff of 4. We've only had 3, which would be the full-timers. If you could hit the next slide, please. And so we're removing, like I said, we're taking 2 to 3 personnel. If all we have is 2 or 3, we have nothing left in our city. Maybe 1 person. If we do a callback, we might be lucky to get 1. We ran some numbers. It's not in the slide here, but we ran some numbers, and basically we're getting 1.53 people back on a callback. We had, I think it was 83 is it 83 or was it 50? 83 callbacks since January until now. And so out of those 83, that average was about 1.53 people coming back on each callback. And so, and we're having about 4 transfers per day is what we're having. So if you go to the next slide, please.
Hey, Jeff, can I ask you a question?
Yeah,
Can you just clarify what that means, a callback? That means they came in and they helped to fulfill a need,
yes.
and then when that need was over, there might have been another need, and then they didn't return? Is that what that means?
So, yeah, so for example, we get a call, and this happens quite frequently. We have 4 people in the station, we're all sitting there waiting. We get the call for a 911 call. We go out on that call, and as we're out, the hospital then calls in for a transfer. So now we have to make the choice. The captain has to figure out, is this call that we're currently on we're able to split our crew? A lot of times they'll take a few minutes, they'll get to the point where they can, they'll let the ambulance go, and then they'll go back to the station. The ambulance will take the first 911 call to the hospital, and either pick up the transfer from the hospital, or the engine crew will come back and grab another ambulance and go to the hospital and take that patient from the hospital. And when we do a callback, that means we send out a text, a page through our phones in the system that we have that will alert everyone else in the department to come back and staff the station. And so on average, we're getting 1.5 people to come back and staff the station when that happens, which means there's just one person there that can take the third call, if you would, at that time. Does that make sense?
Yes, thank you. Just one more quick follow-up question to that callback. Are they more likely to respond to certain requests versus others?
Fires. Everyone likes fire. And so they'll come back, but then again, that happens Sunday. And I think I came back, and to me and one other person. Was it just you and I, Josh? Yeah, just 2 of us came back for a grass fire. And so, I mean, that's.
There was no CAD though. The guys that I
This is
talked to,
true. They didn't have
nobody
CAD.
knew about it.
And so we had to call out. That's very true. But on average, the fire is the one that people will come back for. Medicals, not so much. Good. So with that, we dive into the NFPA standards. NFPA 1710, I mentioned that requires that we have 4 people in the engine, that we can safely operate on a structure fire, which coincides with OSHA's 2 in, 2 out rule. If you flip to the next slide, Cynthia. And you can see that's 29 CFR 1910.139. That states that we need to have 2 people in the structure. When we have 2 people in the structure fighting a fire, we should have 2 people outside the structure to maintain safety, for safety reasons, so that if they need rescuing, we can start that rescue and call for help to get them out of the structure. Again, we're more inclined to have people come back as a volunteer service to help with fires because they're obviously more fun. Everyone wants to fight fire. That's why they're in this business. Unfortunately, that doesn't happen so much for the transfers. If you go to the next slide, please. So back to the Medicaid, Medicare stuff. So our Medicaid, Medicare rates, by law, House Bill 301, I kind of skipped, if you're on that, on my side, I guess it's the right side of the page, if you're looking at the way I'm looking at it. But Medicaid allows us to bill a flat base rate of $1,300. That's it. No more, no less, right? Or we can actually get billed less, we can collect less, because they don't always get to collect 100% of that either. Medicare allows us $700. And House Bill 301 allows us to, if we bill someone that has insurance for a paramedic, we can bill $2,300. For an advanced EMT, $1,600. And so you can see the dramatic difference in fees that we can collect. My proposal of a negotiated rate, and this isn't set in stone, would be a flat base rate of $1,100 for the hospital for these transfers, and then $42.24 per mile, which is a state-regulated rate. I didn't make that number up. What I did to get the $1,100 was I took 60% of our basic level calls, the flat rate that the state gave us, and 40% of our advanced level or paramedic level calls, and I took 40% out of that for paramedic, and I took 60% out of the flat rate that the state gives, and I combine them together and get close to $1,100.
Is that a one-way, the 4224, is that just,
That's just one way. We can't bill round trip. It's only one way. And so we're paying for wear and tear on these ambulances round trip, but we're only getting paid one way. And again, those state-based rates that we can bill for along with the mileage, that's great, but we have to then hunt them down. We are not collecting 100% on those every time. And as you can see with the Medicaid and Medicare, that's all we can get is $1,300 or $700.
But
Plus
who
the
are you
lower-
billing?
Huh?
Who do you propose to bill? The hospital?
The hospital, yeah, with the flat rate that we bill them.
And then the
That
hospital
legal?
bill the patients?
That would be up to the hospital. I don't know how that would work on it. I would guess that would be what would happen. They would have to, and that would guarantee us our collection on that 20% of our billing. Does that make sense?
Yeah, but I don't know if that's,
This is
that
pretty
happens
common.
somewhere else?
Oh, it's very common. Ogden, Layton, Syracuse, and there's a bunch of others that are doing it. It's a win-win, right? The hospital, because we're having trouble, we've been saying that we're not taking transfers or we're pending and things like that. I can't say that we won't pen them because we're still gonna have limited staffing. But this will help us be in a better position to have an ambulance ready to go to take the transfer specifically. And so, Cynthia, can you go next slide, please? So finalize, yeah, skip that one. This is all fluff. Yeah, so we've only missed 2 transfers year to date. That was a question that's been out there. We did the research and exact numbers from Gold Cross. We've only missed 2. We punted those or gave those over to Brigham City and they came and took those because we were either out on other transfers and a 911 call or so forth. We were doing something when we had to give those calls up. So I think I put it in your guys' notes. It's not in the slideshow. Because I removed a few things to make it a little shorter. Let's see. Oh, sorry, that's on the speaker. So to answer your question, Blair, there's plenty of other cities that are doing it. They're actually charging, some of them are charging a flat rate, like I mentioned, that's been calculated down to kind of meet in the middle between the paramedic and the basic level transfer. So you're not having to figure out, do I pay paramedic level for this one? Do I pay basic level for this next one? It's just a flat rate. Others are charging exactly what the state charges. For example, Layton City is one that charges if you're going paramedic level, they're charging $2,300 or they're charging $1,600 plus the mileage. And so Syracuse, they're one that I talked with and they felt that it was more equitable for both sides of the relationship to meet somewhere in the middle on the agreement and work out that ratio of, okay, well, we're going to take the high end and low end and meet somewhere in the middle.
But right now, we're billing the state rate.
Right now, we're billing the patient for the state rate, and then we have to collect on that. If they're self-pay, we're usually not going to get anything in return. And so if we were to do this and the hospital were to agree with it, it would be, that 20% would be guaranteed. And then we would guarantee that they would have 1 ambulance every time they called, because we would have more
And
staff.
Jeff,
Yeah,
Jeff, it's Brennan. Just to clarify, if you charge the hospital for the transfer, then of course you wouldn't bill Medicare and Medicaid. That would be, the hospital could then
Yes.
collect that on their end to kind of make a dent in the charges that you're suggesting. Is that correct?
yes, that is correct.
Okay.
So, for example, I'm just throwing spitball numbers. So let's say we were to run 700 transfers and we billed a flat rate of $500, right? Which we wouldn't. We would make $350,000. That's what the hospital would pay us for the year, and we would be able to sustain and bring on some more personnel that could run this ambulance, this transfer service. And so that's what I'm proposing. I had it in here and I pulled it out, but the proposal, I think it was at the very beginning, is that we bring on 2 additional personnel per shift, which would be 6 total. I know it's a far reach to get them full-time, but that would be the best option, is to have 6 more full-time, which would bring our staffing up. We have 4 now, would bring us to 6 total, which we'd have 6 24/7. On a low end of the staffing, let's say we don't get a part-timer, someone calls out sick, we should have 5, which we could still staff our engine and meet NFPA 1710 with 4, and we could still have enough for the ambulance as well, to staff the ambulance. And then the engine crew could jump staff the second and third out call on the ambulance. So technically, we would have we'd have enough people to run 3 ambulances. Does that make sense?
2 per shift, 2 additional per
2
shift.
additional people per shift.
But it doesn't make sense budget-wise, I don't think. I mean, we just barely finished the budget. We were right on the money, so,
And that's where the hospital would come in to,
well, we're still counting on that part of that money right now to pay budgets. We're
Right.
billing that, right?
yeah. And
We might
this
not
is
be-
kind of a gee whiz for you, and I think,
I just think.
yep,
the
it's in your
budget's
notes.
a Big concern, because I don't think it's in the budget.
Not in the budget right now, and that's what I'm saying. So we would have to go under contract in order to start going through this process to get,
We would amend the budget to reflect the new numbers.
yeah. So just so you're aware, with Gold Cross, since we've started using Gold Cross, this year, we've gone back into last year a couple months, right? Because they picked up in December is when they started doing this. They billed $1,069,875 is what they billed. They've collected so far, and this number's actually gone up because we're in a new month. It was actually 500,000, but the last number I had was $435,172. That's what they've actually collected so far. And
And how
so,
much of that was transfers? Did they break that down? Is that, I mean, that's like,
I
to me,
don't-
it's like the
out of
same
the-
money from two different places. To say
Right.
you'll save 350 to do that's,
that's total, that's the total number, that 400,
That's not-
500,000.
we're already counting on that to pay.
Right. And
We're
so
already paying
my point
1.2
is though,
million.
we've already collected 43 or over 43% of the money that we've billed, which is something we've never done before.
What was
So-
our number last year as far as collections on?
What was it, Josh, you remember?
Last I saw, we had billed 1.1 million, and last I saw, we had only claimed just over 400,000.
Oh,
For
he's
the entire
saying,
year.
he's saying last year,
Correct.
that's, okay.
That was the last numbers I saw.
So we've already
I
hit,
don't know what the final numbers were. or anything like that.
We billed about $1 million and we got paid about $500,000,
yeah,
just round numbers.
and we've already collected that halfway through the year with Gold Cross. And we're still billing, like we still haven't fully collected on everything. Does that make sense?
Yeah, well, that's what, in Gold Cross was happening,
Yeah.
Shari, that was a,
Yeah, and so that's, my point is that we're doing better on that end to what you're saying, to answer your question.
but
We're
what I'm
doing
saying is
better.
that if you say that you're gonna save the 300, and I'm not arguing, but the
Right.
350,000, we're already using.
Yes,
so-
yes, we are using it.
It can't be to say we're gonna use that to hire 6 more guys. That's not the thing. The hospital thing might be a good deal if they go for it but you'd have to get their numbers, in my opinion, to see what
And that's,
they're collecting.
And that's my whole point, is I want
right,
to,
that's the point.
I want to introduce this to you, say, hey, this is an avenue we can take to try to bring on more staffing and increase our revenues.
Without,
This isn't the
without
end all.
increasing taxes or the burden
Yes.
on taxpayers.
Thanks, Bill.
But-
It's an additional revenue stream.
But see, I disagree. I don't think it is. And the only way is if it's another 10%, because we're billing the full thing and getting some of it.
Right. But in this case, we would be guaranteed that we would get that payment. We're not
Hey, Jeff?
guaranteed that right now. Yeah,
One way you could look at this, if you look at your total transfers in 2024, and then compare that to the reimbursement, and then what you want to do is take that same number and multiply it by this 1,100. I think is what the number was you billed the hospital, and then let's see what the difference would be. And then the second point is, I'm looking at the slide where you've only had 2 year-to-date where you didn't transfer. It obviously would have worked in your benefit for that number to be much higher. And so, although I'm grateful that it's only 2, I would have hoped that it would have been more. It would have helped to build your case.
Right.
Because for it to be additional revenue, we would have to see that we had more misses that we didn't capture. So let's make sure that number is correct too. I think that would be beneficial.
okay.
I think that what the chief is trying to point out, though, is that it's less about the number of calls that we take or miss, and more about collecting more money on the calls that we do.
Because Cynthia, can you back up to the benefits of proposal? I kind of skipped over this. It says the IFTs were, like, currently, our collection is only 7% out of that 20. If we can collect all 20, 100% of that, we're doing much better than we are currently. That's my point.
So we do have the number that 7% is the
7%.
transfer amount
Yep.
that we collect upon.
Yeah. And part of that problem is that group is Medicare, Medicaid, self-pay. And they're on a fixed income and they can't pay it. We're just not gonna get it from them. And Medicaid and Medicare, they've capped us much lower than what we can collect from someone who has normal, regular, Blue Cross Blue Shield or whatever insurance.
So
When
pardon
they do
my,
ambulance billing, the state sets this rate that's clear here,
Yeah.
so that the city can bank on this guy paying and this guy only paying this much, because Medicare only pays. Really, the guy that pays,
Paying for half of the
paying
other.
for half the other guys.
Yes.
yeah,
So that's why the rates are so high on this end, to try to get enough to pay for
yeah.
the stuff on the other end.
And if we were to do this contract and if it works out for the hospital and us, it would, like I said, it was help them secure the transfers for them. And then also, and I get what you're saying, Brett, that does make sense that we've only missed 2, so are you really gaining anything if we only missed 2? That makes good sense.
I think the numbers would be, to get them numbers would be,
Okay.
like what Brandon just said, to see where that is, the difference, because
Yeah, the net
the
effect.
steady stream would be good
Okay.
if it's beneficial.
It would need to make financial sense for the hospital as well, naturally.
Yeah.
Any other
What
questions?
level of acute, or what level of professional do you need to drive the ambulance?
You mean training wise?
Yeah, who can drive the ambulance?
So we need EMT state law. I asked the State Bureau of EMS, and they said we have to have, and they're supposed to send it over, but I didn't get it before I came over. They're supposed to send me the actual state law so I could look at it and show it to you. We need EMTs. We can't have anyone except for EMT, someone who has the training for both the medical side and the driving side, the EVO training. They said that, I guess the only way we could get around that is if we had an officer who, peace officer who is EVO trained, is on scene, and we need the hands in order to drive the ambulance, because we need both EMTs in the back. Like, let's say it's a day where we're running short, 2 of us are on a transfer, we only have 2 people from the engine that are now in the ambulance, and they need to do CPR and administer drugs. An officer could drive the ambulance to the hospital, because they can work the lights and sirens and do that type of thing. So, otherwise, we would be violating state law if we let somebody just come off, work and do that, so.
And how many are you required to have on each ambulance
2.
in the back?
Oh, 1.
So 1 driver and 1 person riding and taking
Yes.
care of the patient, correct?
Yep,
And both EMTs or higher?
or high, yep. So EMT basic level would be like the lowest.
And so with your proposal here, would this be EMT basic level, full-time people that we're trying to hire?
It would be advanced level, because that's the level of care that we're at right now.
What?
Advanced, so there's basic, and there's advanced, and then paramedic. And so the reason we have advanced is because we have paramedic service, and so it would be smarter for us to run the paramedics advanced with the paramedics, because the advanced I like to look at it as you have a doctor and you have nurses to help the doctor, right? So if you brought in the ER tech, who's just there to do IVs and stuff, he can't help, or that person can't help the doctor. Does that make sense? They
Kind of,
can't.
but if they're just driving. But
Right.
you can set me
So
straight.
if something goes wrong in the back and you're back there, if I'm a paramedic back there by myself and this person was doing fine as we're going down the road and all of a sudden they code on me, we have to now pull over and then I need that EMT to jump in back. So if you were to be up front it would be very hard, difficult for you to jump in back and help me draw up meds, help me do procedures that I need to do, like intubate and things like that. And I could be held liable for that in court.
Well,
we're
it's
just
not-
opening
it's not me.
ourselves-
We're not talking
I'm just
about
saying,
me.
if we had someone like yourself driving that wasn't an EMT,
No,
you
no,
couldn't
that's
jump
not,
in back
that
and
was,
help.
that was never the question here. It was always
that
an
was the
EMT,
question.
advanced EMT, and paramedic, and I'm just going with basic EMT.
Oh,
If we
okay.
had basic EMTs driving.
I thought
it
that was your question, though, was
No.
someone
Then-
outside of
Then wouldn't that
EMS.
cost us a little less money to have that staff versus advanced or paramedics on a shift?
It wouldn't cost us that much less, no. And then we're downgrading my point is that we're downgrading our level of care. We're asking a ER tech or someone that doesn't know they can't even administer an IV. So all they can do really is put on Band-Aids. And so we're asking someone that doesn't have the level of training that we need to assist the paramedic to be there. Technically, we should be running two paramedics, but we got a variance to only run the one. And so, because we don't have the numbers. And that's what I'm trying to do is augment our staffing so that we can better care for the citizens. So,
Got a question from
Yeah.
Brandon.
sorry, Brandon, go ahead.
Hey, Jeff, can you go back up to that slide where you broke down what you can charge? Yeah.
Keep going, Cynthia, keep going up. Is that one? Sorry, no, it wasn't that one. Go down, sorry.
That's all right.
Where did it go? It's down further.
Okay, that's it.
Yeah,
Okay, can I have you clarify something for me?
yeah,
So with the Medicaid, their base rate's $1,300.
uh-huh.
I want to make sure I understand this House Bill 301. So if there's a paramedic on board, you now can charge $2,300? Clarify this for me.
Correct, you can charge $2,300, that's a base rate for the paramedic. We can't charge.
And so that would be that would be the total. So that $1,300 that's Medicaid is built into the 23, is that right?
No, that's in place of the 23. So.
That's what I mean.
Yeah, you're almost there. You're understanding it. So the House Bill 301, that just passed in the beginning of May. And so that
Okay.
says that we used to be able to bill for base rate plus supplies plus the mileage. We can no longer do that. What we can do according to House Bill 301 is only the $2,300 if a paramedic level care has been administered. So a paramedic gets on board and they do a 12-lead EKG, we can charge $2,300. If the advanced EMT is there and they take the call, it's $1,600.
Okay.
And the only thing we can charge outside of those rates, those two base rates, is mileage and then for drugs, which if you guys saw the amount of money that we pay for the medication versus what we can charge for it. For example, Narcan, that's one that we pay about, is it $65 a vial? Narcan? I think it's
30, and I think we can only build
it's 39, yeah, I know it's 9 is what we can bill. So it's $9.50 is what we can bill, and we're charging $35 for Narcan. That's one we use on almost anyone who's unconscious to rule out narcotic overdose, right?
Yeah.
And so we're spending and wasting a lot of money on Narcan for one. There's others where we're charging, or we're billing, we're paying out of pocket $20-$30 for it, and we're only charging 3 cents, 5 cents, because the state won't allow us to charge any more for it. We're below generic prices. with
Okay,
this
let me
bill.
just-
So all we can really bill is the base rate and then mileage. And so the $1,300 is our base rate for Medicare, no matter if it's paramedic or an EMT. Does that make sense?
Yeah, let me just ask a couple more questions.
Yeah.
So what about the Medicare where the base is 700? Is that House Bill 301 also allow you to jump to the $2,300 for a paramedic?
No, you stay at 700.
Okay. So think about this. So the majority of your transfers, they're Medicare because you said they were 65 and older, whereas Medicaid is more of that state coverage. I think everybody understands that. So I mean, maybe I should recuse myself because I want to make sure that this is a good deal for the city. But also, I'm trying to think: would this be something that Intermountain would sign on to? and I think they would, but the majority of our transfers are going to be Medicaid. I'm sorry, Medicare.
Okay.
And so,
I don't know
Is that
off the
just-
top of my head, without looking, I would have to get on and look, see what go across is saying if that's the case or not. And so I don't know for sure, I couldn't tell you.
okay.
So Brandon,
I
I
think-
got a question.
Yeah.
Has IHC got some other communities that they're doing this with already?
Yep.
Have we got some comparables that we can go to and see how they're doing it?
Yeah, it sounds like Jeff said that this is happening with other Intermountain facilities. So I think it'd be worth looking into this further. I think it could really resolve problems because we might even have a better system at Intermountain on the collection side to make sure that we capture more than what the city's been able to capture, because we probably have people that can kind of go after this and bird dog it more. So for me, I'd be wanting to sign on to this as long as we could somewhat get reimbursed around the $1,300 amount once you pay the $1,100 base rate plus the mileage.
Okay.
So if we could somehow capture that $1,300, it would be a win-win because both sides of us now could predict and budget
Right.
and not have anything pop up that would, that would kind of cause our budgets to be off.
Yeah.
That's probably one way of looking at that.
Given,
And if
given
it-
that it doesn't require us to, increase our
Yeah,
operational expenses without increasing operational revenue
yeah.
by the necessary amount.
Well, I think the possible negotiation rate with Intermountain just comes down to you sitting down with them and starting to negotiate what's going to be the best price. And I think that's going to change a lot
Yeah, okay.
according to what their
Oh, yeah.
needs are as
Probably
well.
where
I
they're
realize
already doing
that.
it somewhere else for the.
Yeah, and like I said, Syracuse is in the contract with Ogden Regional right now. And so that gives you an idea. I know they're different, but that gives you a good idea. So, and that's where I got the $1,100 from, was based off of the state calculations to get that rate. And I don't have that, I didn't put that in here, but, so yeah.
But Jeff, if you could show that by going with this model, you would have created an additional $300,000 in revenue in 2024, then it shows that you could you could bring on additional staff and it could be covered. So I think that's really what we have to really look at those numbers before we can move forward. But I think it's worth looking at.
Okay, yeah. And
Can I say something too?
Oh, sorry.
I think this new billing company, when Brandon was saying, the hospital has ways to collect, I think these new guys are gonna do a lot better at collecting than what not that Sherry done bad, but just didn't have all the tools that she needed.
Well, she was one person. I think, I agree with you. She was one person. They've got a whole
Right.
team of people that are doing this, and they're doing a great job. I agree.
Right, they have a guy for Blue Cross and a guy for every insurance company out there knows how to get that money. Do you have a breakdown from the time that Gold Cross has taken it over on their collection rate?
I do, but I don't have it on hand to, what was that?
43%.
It's 43%, yeah, 43%. So I don't have are you asking for like a graph, Wes, or?
Yes, something that would show, up to this point, but if they've only collected 43%, is the other, 56% still being collected, or are they already starting to write off all from what we bill to what they pay?
They're still collecting on it. Because some people, like, for example, some people on a payment plan, they put them on payment plans, and they haven't completed their payment plan. And so every month that goes by, we'll collect whatever their payment is, their minimum payment, right? And that will increase our numbers. And if they got, I don't know, 100,000 people doing that, then that's whatever that number equals out to. Does that make sense? And so
Yeah.
it's gonna take a year or two for some of them, depending on how big their bill is, to finish collecting.
I just got, and maybe I missed it, but it's the 1,100 plus the mileage,
Correct,
and you're gonna bill all that to the hospital.
correct.
So what does it say here? At McCady transfer would be 1,800
44, yeah, yep. For the mileage.
Well, with the mileage,
44 miles times 42, 24, which would, hang on a second, let me get there.
that's like driving a Ford. Isn't it?
Yeah, I know, right? Aren't those Chevys supposed to be more fuel efficient? Where'd it go? Sorry, oh, here it is. So I can give you some better numbers. So from our hospital to Logan Regional, it's gonna cost about $1,144.70. To McCady, it's gonna cost $1,858.56. And I can keep going if you want. Ogden
No,
Regional,
but I'm just saying it's, so the hospital would get the $1,800 bill plus the
plus
1,100.
1,100, yes.
So to be the 3,000 or whatever.
Yeah, about, yep. Like I said, Syracuse, that's similar to what Syracuse is doing currently. Layton City, they were billing the either $1,600 or $2,300 plus the mileage. Ogden City, they met somewhere in the middle as well, and they were doing something similar.
So I think it sounds all right, but the devil's advocate, why would the hospital do it? Could they could bill the rest?
They can bill for the total amount. They
The
can,
higher amount?
yeah, they can bill for the total, like Brandon was saying, the total $1,300 or $700 plus the mileage, and they would recoup the mileage 100%, and then they would recoup the $700 or
And extra
$1,300.
whatever.
Yeah.
Okay.
So Jeff, and do you have sort of a comparison between the two ideas? Can we see if there's a
I do not in the
benefit or
slideshow.
cost to, sort of that idea? Maybe that's something we should,
Like
I know it's just probably something we're just kind of,
it's hard to get a number
Hard to get it right
comparison
now, but
because
you
we
know,
didn't really track the numbers like Gold Cross is doing, and so I only have from December until now, and so that's why I don't really have that number for you, because it would be an inaccurate number. It would really be a projection is what it would be. And so I'm sorry I don't have that. I wanted to do that, but
Even if you had for sure the ones that went and you got with it, whatever we collected.
Just model it, yeah.
just kind of
Against
give us
that
some sort of an
number?
idea.
Yeah.
To see,
and I can find that out. I can find out if Gold Cross, let's say we did, was it 357 transfers? I can find out how many of those 357 that were self-pay, they couldn't collect
Yeah, how
anything, how many
much
were
money we got
Medicaid,
out
how
of
many were
that?
Medicare. I can
Besides-
find those numbers, yeah. So,
that would be good.
Because I think
That's gonna
that's
take
the,
some
the
digging. I'm gonna-
necessary number to translate it back to the budget, right?
Right.
Which I think is what we're all driving toward.
Kind of what I was.
Seems like a creative solution as long as it has
Yeah.
that impact.
so I did start looking at that, but the problem is I have to export. Maybe I did it wrong, and Josh may be able to help me on this one, but, because he's a guru on this on the billing stuff. But we have to literally go in and export them into an Excel spreadsheet, and then I gotta print the Excel spreadsheet or look at it on the screen, and I gotta go, okay, this one, no pay, that one, this is their, and then I gotta write down the numbers, add it up. And I tried putting it in a spreadsheet, and it wasn't jiving.
You bring me the spreadsheets, I might be able to
So,
work some
'cause
magic.
I had to separate it out, and so I actually, it was working, but it
the
didn't.
We can run a
difference for
pivot
me
table,
would be
though.
the difference that they collected, the way we're doing it, and the difference that this would be.
Yeah, that's,
Because we counted on, what we collect is what we counted on anyway for this budget year, so,
Right,
you know what I mean?
This
For a
will be
while, it
looking
won't
into-
show a lot, but this might be
yeah.
more steady.
That's right. And
That's the point, is this would be steady.
And
if we're projecting this out a couple of years, when it is steady and everything's locked in, we could easily see that this could justify helping to pay for a couple of new firefighters and EMTs to help fill this kind of role. So that's the hope.
I mean, it's a lot to add somebody. I mean, a part-time guy's $170,000 for just one.
Yeah.
If you cover it 24/7 at $20 an hour.
Right.
So it's not, that's just one spot.
Yeah.
And so on that very last page in your guys' little packet, if you see down at the bottom, it has a red square there, or red rectangle. There's a green and a red number. That red number says Medicaid, Medicare write-off amount by law has been about 386,000. We have collected 50,000 of that. Does that make sense? Does that help you? And so Brandon, that'll be in the, I don't know if you found that one yet. Did you find that?
Yeah, I looked for the packet you sent me. It didn't come through. I'll have to get that from you later.
Okay.
Jeff, if I could play devil's advocate one more time, Blair brought up that we're going to have this other collection company with the city. I'm also a little bit worried that maybe this would be too good of a deal for the hospital, and maybe we got to look at to see what kind of collection, how much that changes to your benefit before you model this with the hospital. Because if they're doing a jam up job, you might be leaving money on the table for the city, and that wouldn't be good either. So I'm not sure when to pull the trigger on something like this.
Okay. It's a valid point. Thank you.
Sounds like you could do a little more analysis on that and, get the comparison. That would be really good.
Well, maybe even a little bit of time just to see what our collections rates end up
And with
being.
Cold Cross?
Yeah.
Yeah.
Okay.
Yeah, it looks like it's up 42%.
Yeah,
First quarter, their first, yeah.
so they're doing a great job. So, all right. Any other questions?
Council?
So I just got a question on your policy or what the agreement.
Okay.
Obviously, you said the hospital hasn't seen it yet, so
Yes.
that'd have to be a big negotiation, but I would just make sure it's all not left to a couple of guys deciding it. Needs to have a clear of what you go on, what you don't go on, what you go.
Right.
I think it's a slippery slope if it's,
And I don't know if you
if
guys
I'm the
saw.
guy deciding right at the moment, I can make a different decision than the guy that's sitting
Right.
back not having to do it. And I think that's
And I think there's been a misconception that we don't want to take the transfers. I don't know where that came from. I haven't seen that or felt that. I know there is concern, so today, actually this morning, there was a transfer that came in and a medic, I told them not to take the transfer because unless they could send a nurse with them, because we haven't had formal training from the hospital on their pumps. There's case law after case law where medics have taken equipment from the hospital and used that equipment, and then the person winds up dying or having some kind of other injury outside of what they already had, and it was all because they were found negligent because they didn't have correct training. I'm trying to save the city from anything like that happening. That's the last thing any of us want, I would assume. And so that's where I'm at with it. And so the policy that I wrote reflects that we're only going to take equipment from the hospital if we have the correct training. And now we're working on that. We're working on getting a time and a date set up. We're looking like more towards the end of August that we're going to do that. We're hoping the 25th or 3rd, somewhere in there. And so if the hospital can help facilitate that, because it's their pumps. And I've had a discussion before with some of the staff at the hospital in the ER, Dr. Nance was one of them, and they agreed that, yeah, we don't want you taking the equipment if you're not sure how to use it, because that totally defeats the purpose of having the medic there if they're doing things wrong with the equipment and they're possibly going to injure somebody. Does that make sense?
It does, and I know transfers. I mean, I'm in this business. The transfers are a pain in the butt sometimes where they go.
it is what it is.
Transfers are a total pain, and we probably hardly get paid on them.
Right.
So we might make money on them BHUs from the hospitals, but it's just a part of the job. So does vacuuming the fire station before you go home.
It
just
is what
part
it
of
is.
So
It's one call is the
it's a
same as the
mindset
next, you know?
in a way. But
And so that's where we're saying, and then, I don't know if you guys are aware, we took one just the other week to Boise. And we had 4 people in the station, and that took 2 of us out of service with an ambulance for 9 hours,
I've been
That's
to
a round
Boise
trip,
transfer myself.
you know? And so that's what I'm saying, if we had 6 people here, that would help to to cover us in those situations. And I've talked to Chief Lewison and Brigham. They're taking more transfers out of Brigham Hospital down to Boise, or up to Boise as well. And so if they're doing more of them, I can see us doing more of them. And I'm just trying to help get ready for the future. When we start taking, I mean, it's obviously, you see the numbers, we've gone up every year in transfers. And in call volume, 911 call volume. And so it's coming whether we like it or not. I'd like to be ahead of the curve than behind it, because that's where we run into real problems.
I, for one, think you need them, but I'm totally after this year's budget, there's no budget.
Oh, and I agree, and that's why I'm saying this, the contract idea came about, because I'm like, hey, this is a way we can maybe kill two birds with one stone, and this could work out for the hospital and for us, and so.
As part of your contract, I went through that, and I've got a lot of language that I'd like to introduce into it that addresses exactly what Blair was talking about.
But I like to say, I've never written a contract before.
No,
No, no.
it's not from a.
So I
but-
realize that, that
Right.
the language is not gonna be there, and I know IHC has their own legal department that's gonna go through this with a fine tooth comb and be like, that's a joke, and they're gonna give me one that's gonna look 1,000 times better. This is a starting point, it really is.
I understand, and we're baking it, and I just added some more ingredients is all. But what I'd like to do is just have you look at those as well. It gives more objectivity to making those decisions on who should be transferred and who shouldn't be, and put a lot of the onus on the physician, which that's where it should lie, because they're the healthcare professionals. So, but are we going to talk about this more in the next, or do you just want to run with?
Well, it's going to be in the, on the agenda, so we can address this more.
Okay,
later.
well then,
My goal today was to get approval to go to the hospital and start this process, and move forward
Start the
with it.
negotiation.
Yeah,
at
start
this
the
point.
negotiation, building a contract, seeing where, if, giving them more numbers, more data to run off of, working with Gold Cross and getting the numbers situated so that we can see if this is even gonna work. And at the very least, come out with something that they can understand and see our protocol, they can have that, and then we can have their protocols, their procedures, and we can meet in the middle and make at least an agreement where there's no more questioning what patients we will take. Training and things like that will be outlined in it. Weather, fatigue, all those things are in my policy. And so, we're not the only department that's doing this, that has a policy addressing this.
And are there some others that you can, like you mentioned Syracuse and some of these other communities?
Syracuse, Ogden,
Get some-
Layton, Logan, like they all have policies on this, and I've already talked with them, which is where my policy evolved from.
Okay, good.
I got two things real quick, Jeff, before we're done here. One, where are you gonna house them other two? Where are you gonna put two more guys up in the station?
We've already accommodated one more room, like we built one more room, and we have enough
Right.
to bed 5. And so I would think it would be an easy task to either add an additional room or have 2 people bunk in one room together for a little bit until we can get that situated.
Okay. And then
That's something we can
two,
address when that happens, if we get there.
right, and then two, the callback. How come we've lost all of our callback that we used to have?
This is a problem I think has been going on for much longer than I've been here. And I don't know, I would assume that you guys might be able to answer that one a little bit for me. As far as I look at it, we're not paying anyone to be on call. And I know that it stinks that I'm saying this, because I don't like to say it, but it's the truth. We're not paying them to be on call. I can't hold someone liable or obligate them to come in on their day off with their family, when they're in school, when they're, whatever they're doing, right? They're on vacation. I come from the volunteer era myself. I volunteered for 3 years back east. I was a hydrant man. That's all I did. I jumped off the truck, I wrapped the hydrant, I flagged them down, I sent them water when it needed to come. And so I loved it. And nowadays it's just, and I sound like an old guy, right? But they don't make them like they used to, right? People aren't volunteering like they used to. Everybody
Right,
wants to get paid.
but I still think that do we have,
So I guess my question to
Open
you is, how do we
positions?
go about securing volunteers? I don't know what you guys have done in the past.
I mean, I think to have the
Paper.
conversation with your guys to say why. I mean,
Word of mouth
I've
or,
been around a little. I mean, some guys want to come back and they'll wait there till that next ambulance gets back. Some of them don't want to come back and go on the transfer to Provo, and some crews want them to go on the transfer, and some crews don't. I think you could fix that by, if you're home, I'll go sit there for an hour to cover, but I don't want to go to Provo. But if I go down there and they have me go to Provo, then I don't want to go. And and there might be 6 different scenarios like that, but I think I think our part-timers need to be, if we can, they had to have a bonus point for living in town, because they'll more apt to
Right.
come.
Right, that's where I was going with this is, I think that if we open up, I think you've capped the number of part-time guys. Can we not open that up to more part-time guys that, and the bonus point, like Blair said, if you're in town, some of them guys are gonna come back. I don't know why we've got a limit on our part-time guys.
part of
I
that
don't-
is equipment. We don't have equipment. We'd have to come up with more money to buy more turnouts and stuff like that to outfit these guys to be able to come back to go on a fire call. I have a couple more guys that just moved into town and they're great candidates. They have all their certifications. They work full-time for another department and they want to work here. But I don't have the money to buy more turnouts to outfit them. So we've got to maintain.
If we're gonna have to call it good here. We can address this a little later in the meeting and, these questions that everybody's got. So I think we've got some time to, do that in the agenda but let's take a little break and we'll try to start at 7:00. go ahead and get started. Like I said, I'll call this meeting to order. Opening ceremony, we're going to have Councilmember Lewis, if he'll lead us in or he'll offer a prayer, and then Councilmember Rhodey will lead us in the pledge. We'll go to that point.
Our Heavenly Father, we come before Thee this night. We're grateful that we have the opportunity to meet. We're grateful for the privileges that we have in this country and for those who have sacrificed for us that we can be free. And we're grateful for that freedom and ask that would please bless us in our decisions, that we'll make wise decisions and that we'll counsel well together. And we pray for unity, that our hearts can be one, is our prayer in the name of Jesus Christ. Amen.
Amen.
Everyone rise, please. Will you repeat the Pledge of Allegiance?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Thanks, Brett and Bo. Okay, I think we got some new people here. I'll go through and sort of introduce everybody so that you know who we all are. Over here to my left, we have our city manager, Bill Kobabe, and then Brandon Vonk is on Zoom with us. He's out of town, so he's participating via online. And then Bo Lewis, Blair Westergaard, myself, Brett Rhodey over here. And it's not that we don't like each other, it's just that Brett is a little bit under the weather, and so he felt like he needed to be a little bit over there, so, and that's fine. Anyway, we wish you well and hope you get recovering and feeling better soon. Wes Eastep is online also, he's out of town. Then we have Cynthia Nelson, our recorder. Zach Lefevers, he was here a little earlier. I think he stepped out for a little bit. Let's see, Lindsay, are you here with us? Oh, I'm sorry. There you are, Lindsay. Greg Horsfield's back in the back. We have our police chief and Lieutenant Police Chief Cordova and Lieutenant Skylar Gailey. So, did I forget anybody?
Jeff.
Oh, Jeff Jarrow, yes, and our Fire Chief, Jeff Jarrow. We're pleased to have our veterans here with us this evening. We recognize you. With that, council, declarations of conflict of interest. Are there any conflicts with any of the agenda items on the docket this evening? Hearing none, we'll move on to the approval of the agenda. Council, any changes to the agenda, or are you good with what it is?
If you don't mind, Brandon may have a little bit of a conflict with
I was going to mention
the
that.
Intermountain contract and that contract with the fire department, so, and where Brandon's new,
You wouldn't, okay.
so.
So we may have a conflict there. Brandon, did you hear that?
Yeah, my apologies. I wasn't sure we're going to go into depth again on that contract, but I'll be sure not to participate or weigh in if it in any way.
I think I think we would appreciate your expertise and your knowledge here. I think it would just come down to making a decision where there might be some issues there, so.
Yeah, the conflict
Okay.
of interest statement just states that if you or your family benefit financially from the decision, you need to recluse yourself from the discussion. We're not talking about any money or anything right now. He could be involved with it.
I think his input would be, I would appreciate it. I would appreciate the input that you would have. Yeah, I think at this point, we're sort of in the preliminary stages, and like I said, I think your input would be very valuable. But anyway, with
I'll
that,
just be thoughtful.
we are considering, we're considering approving this resolution, so you may have to recuse yourself from that
We're
decision.
just gonna approve to go ahead to pursue it, right? We're not approving the,
Actually pursuing to have him go ahead and
okay.
continue to make the negotiations and everything. All right. So with that, Brandon, I think we understood that you have a conflict there, so I think we're good to go forward and under those conditions.
Make a motion, we approve the agenda.
Motion by Blair. Do I have a second?
I'll second.
Seconded by Brett. All in favor?
Aye.
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 Thank you. Approval of the minutes from July 14th and 15th, 2025. Do we have any questions with any of the minutes, council?
I'll make a motion that we adopt the minutes from
Okay.
July 14th.
I'll second.
15th.
Motion by Brett and seconded by Bo. All in favor, say aye.
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 Motion passes. Thank you. All right, this is the moment we've all been waiting for. Presentation by the American Legion. And I understand, John, you're going to be,
Would you like us facing you or the audience?
face us.
Okay. Zach, you better get right up here in the middle, sir. Yes, sir.
You got a bone to pick with you.
Right up here. I don't think I need a microphone.
We need the microphone so we can record you.
Stand there.
We're new at this.
Should I, hello?
Just the one on the,
Okay. All right, have a seat, gentlemen. Thank you for letting us be here today. I'm the Commander John McClellan from the Tremonton Local American Legion Post. It's my good fortune today to present Zach Lefevre with the certificate of appreciation, and we did try to keep this from him, so I'm glad he's kind of didn't know what was going on. I've witnessed this gentleman's work for some time, really. I was when back in the day when he first started with the city, basically, and I was serving with the Chamber of Commerce back then. I know this man's a hard worker. He works weekends, holidays. I know it might be part of his job description, but I know he's always there cleaning up after, preparing things before every event. I know not anyone can do this by themselves, and he's got a great team, and I acknowledge that team. But this guy, he's a scholar in my opinion. I've called him on his vacations. I've called him on the weekends. He answers the phone all the time. I ask him, is this going to get done? Is that going to get done? Where's this going to be? Can you have that? Always performs. He's always there. He's not always thinking days, hours, weeks ahead of every event. He's thinking months ahead of the event to set things up. It's been a pleasure for me to know this man, and after quite a long time, really. It's been a pleasure to know him and work alongside him, see him doing his due diligence for the city. So thank you, Zach.
Zach to post online.
You just caveman in there, you can't. Yeah, seriously, thank you. Appreciate it.
Congratulations, Zach. Thank you. Thanks, everybody. Thank
very
you.
much.
Okay, we have a Years of Service Award to Jared Morgan with the fire department. This is 10 years. Chief, are you going to present that?
You gotta come stand up here, Jared.
Okay, Jared, he's kind of like the silent worker. He just comes in and gets the job done. I often, he doesn't say a whole lot, but he's one of our hardest workers. I know he's always picking up shifts. He's, like I said, he comes in, does his thing, and he goes home. He's one of our best EMTs, and I appreciate Jared and the 10 years that he's put in with our department. Thank you, Jared, for all your service. Thank you.
All right. Congratulations, Jared. Good job. Appreciate it. Public comments. This is an opportunity to address the city council regarding your concerns or ideas that are relevant and germane to the to municipal business. We ask you to keep your comments to 3 minutes or less, and the time is now yours. And state your name and for the record.
I'm Abby Buckway. I'm here to just share some concerns about the recent robberies going on in Tremont. A couple weeks ago, my dad had his truck stolen, and just last weekend we had a few more. The people that did it stole from 3 different parts of town. They were in the Archibald Estates, Radio Hill, and the neighborhood by the walking trail. They were driving through front lawns, breaking windows, rummaging through people's cars. They even left an abandoned car in the middle of the street, all without the police noticing. My main concern is that these people stole many firearms from my family included. Personally, I get off work really late at night, and I'm a little bit worried about my safety having these people around with stolen firearms and stuff. I just think we need to do better at patrolling at night, and I have some solutions to keep people aware of the problem and hopefully prevent it. We should have, more police on at night, hopefully, especially during this time where we know that this happens every summer, and I think the police department is aware of that too. And I think we should be utilizing the alert system that is recently happened, or some other way to get information to the community about this issue, rather than having people find out on Facebook or through neighbors. And that's all. Thank you for your time.
Do you want to take a minute and, Chief or Skylar, can you go over this a little bit with, I'm sorry, I didn't catch your name. Abby. Backward. Okay.
How fun and
Okay.
games till it's in our neighborhood now.
All right, I'll close the public comment period. Thank you, everybody. Thank you, Abby, for taking that time with us, and I hope we can get your questions answered there. So, okay, new council business. Discussion and consideration of approving resolution number 25-40, accepting interfacility IFT an interfacility IFT agreement between Intermountain Healthcare and the Bear River Valley Hospital and Tremont Fire Department and for the ambulance transfer services. I'll get this right. For ambulance transfer services. Okay, I think we're going to have you back up here again, Jeff. And we've had a long discussion about this earlier in our work session. So I think we've got a lot of the questions answered, but maybe you can fill in on anything that is relevant that we need to talk about at this point. And then maybe the council's had some time to think about this a little bit.
My
so.
question is, we're just voting on pursuing, and I mean, obviously, we know we're all in the first stages of all this. So there's two is maybe that money thing, if that's a thing, plus the contract, yeah.
Yeah, I with this particular one here, I'm going to suggest we table this because I believe there's a lot more that needs to go into this rather than passing this particular resolution at this point.
I was gonna suggest the same.
That's kind of my feel at this time.
Do we have to, I mean, this to me saying, okay, we're good with it, we're not, but we're not ready for that, right?
Right, so tabling, if that's the concern, tabling would be a good option. But if you wanted to discuss it further with the chief, or if you had other thoughts that didn't get brought up in the work session, then now would be a good time to do that as well.
I think with this though, what we're saying is I think we're interested in moving ahead, even though maybe we're tabling this at the moment, or if that's what the council decides, I don't know what they're going to decide, but the idea would be that I think we need to pursue this, not just put it on the table and forget it.
Right.
You
Gather more
know,
information.
We just need to keep the ball rolling.
Yeah. I agree.
But this is the transfer contract, plus, I mean, the extra two people's not part of this, right?
Not necessarily. The idea was to kind of get the contract in place, see how that funding shakes out over the next, I don't know, however long, and then we can look at that.
That'll
as-
be a different,
If it's an additional revenue stream like we're hoping it will be, then possibly that could be used to fund an additional
yeah.
officer.
Yeah, I think it's good, but I know they're, just reading this, just what I read earlier today, there's just a lot of big stuff that I think most of it has to happen when you decide not to take one. You gotta have it straight up, and then maybe more of a higher level deciding that we're not, or not just the guy that's tired, or, you know what I mean?
Yeah, we need a real decision tree with it.
Yeah, and up the ladder, and not vague of command staff. It needs to maybe spell out till you have a full command staff. Really, you're it.
And so I have a decision matrix that basically it includes weather, fatigue, hours of work prior. Like, for example, when they went on the Boise transfer, that crew shouldn't have to take another transfer after being gone for 9 hours on the road throughout the night. Either we would pen the transfer or we would rotate the next crew, and it was more than likely what we would do. And so, like I said, the goal is not to turn down the transfers, but the ability to do that when it's necessary for safety needs to be in place. And that's what I'm trying to do with this, with the contract and with our protocol, is outline the parameters so we don't overwork people and wind up having a bigger issue than we want. So.
Yeah, I'm good with, I think the tabling, the vote's great, but I think we need to keep moving.
Yeah, I mean, we definitely need to table this specific one though, because it's talking specifically about the agreement, and the agreement is not even close to being drafted. Therefore, I won't be able to say yes.
But the tabling would be something that would be,
allow-
with the idea that we're moving forward.
Yeah.
So if you,
From here, I would go to the hospital, is what I'm asking. I go to the hospital, meet with them, work on negotiating the contract, and then come back with something finalized at a later date.
If I was to vote for it, it'd have to be the hospital would say, yeah, we can live to that, and so can we. I'm not gonna make one up and then hand it to the hospital and say that's the way it is.
Oh,
'cause
yeah,
that
yeah, I don't expect them to agree to that either, because they haven't even seen it.
Right.
That
so it
wasn't
seems to me we have two separate things going on here, right? We have this agreement, and then we also have this contract for, it seems like we're doing two different things.
Yeah, they'd be separate.
Yeah.
They'd be separate, yeah.
Well, if you don't mind, can I go over some of my ideas on this? I mean, we've got a few minutes, don't we?
Yeah, please.
Is that okay? I sent Cynthia a copy of what I thought should be added, and I highlighted those in purple. And remember, these are just suggestions. We're working together. It's like I said, we're trying to bake the perfect cake here, and so these are just some ideas. But this is an area, the transferring physician shall have final authority on the medical necessity and clinical aspect of the transfer, including patient acuity level and required accompaniments in accordance with the AMTLA requirements. IHC may request a joint consolidation with Tremont Fire Department command staff in a transfer request if the risk is declined. Okay.
I don't agree with that.
Well,
And
okay.
I don't know what the EM
EMTALA?
is. I don't know what that is, first off. Second of all, we're removing the purpose and of a captain, of a shift captain. We're removing him from the equation. Now to have joint agreement on it, I can go with that. Like I said, the goal is not to decline the transfer. The goal is safety. If have crews that have been running all day and we're asking to pend the transfer, I don't see anything wrong with pending a transfer until we have crews able to take that transfer.
But I think you're putting us at risk if you're putting one of your captain's expertise over that of a physician.
That's
That's
I
the
think
concern.
It's a big slippery slope.
Yeah.
I think we've.
So does the
actually
physician
had some of that,
understand what has
when-
happened
when
throughout the
somebody
day? If
thinks
we're
they're
given,
smarter than a physician.
no, I'm not saying that. You guys
No,
are taking
but
that.
we've had that. We've
Okay,
had
well,
them, you know what I mean? I think I'm
So-
with Brett.
so here's what I'm saying. Why have the captain there if we're not trusting them to do their job?
It's
Trust my
not trust.
captains to do their job,
Not
and they're
trust.
making the decision not based off of whether or not they want to take the transfer or the patient's, whether or not the patient needs to be transferred. That's not the discussion here. The discussion is safety of the crew and whether or not they've had sufficient sleep, whether they've been running calls all day. The doctor doesn't know those things, and if he's the sole person making that decision, you now take away the
No,
ability to actually
it's
run
saying
the
have a
crew.
consultation.
So
between-
can I ask a question on this?
Consultation makes sense, but it says him being the final authority,
Chief, let me,
right?
so this statement, though, is whether or not a transfer is requested or desired or needed, not necessarily whether Tremont does it or not.
Correct.
They still have the ability to say, we can't perform this transfer safely.
Yeah.
So I think that's,
And then the hospital can reach out to someone else.
I think that's what you're getting at. And I think maybe that's something that you're missing in this, is that
Okay.
you still have the authority to say, we can't do this transfer. You're going to have to call someone else.
Okay,
All
well,
this is saying is the hospital is the one making the determination.
But if we're letting our captains take on that liability, we're in for lawsuits, I guarantee it.
Yeah, it's
Okay.
just a mitigation of risk.
okay.
So-
I mean, I read it that way as if you were saying the doctor had the final say on whether or not they take the transfer, because if
Tremont has
that's
to
the
do it.
case,
That's
That
not,
doesn't, yeah, this is just,
He's just saying, he's the guy that decides that it's all they need to go.
Right.
And then if we can't do it,
that's
then
always
somebody
been,
else.
that's always been the case.
But I
We-
think
we're
you have
never
to have
asking-
your things set up. It's gotta be more cut and dry of not just that guy's opinion.
Right,
I
an
mean, you can
EMTALA,
try calling in two new guys or something.
right.
There's a lot of different avenues.
Like I said, it was never the point of turning down the transfer. The state law states that we should have, let me actually get it, I'll read it to you. It says that we should have a backup. We should have basically one backup and then a second backup. So if we can't take a transfer for whatever reason, whether we be out of service because we're already on transfers, that we would have a MOU with another agency. So municipality shall enter into an interfacility agreement for the provision of backup interfacility transport and interlocal agreement described in subsection 2B1 may use the primary interfacility transport service provider is unavailable. The municipality shall share a copy of the interlocal agreement with whether it be Brigham, Gold Cross, whoever that is. We'll share that interlocal agreement with the hospital and with dispatch. So the way that would work is they already know this. That's why I want to do the contract, because this has been a problem in the past, right? You said it yourself, Blair. When they call for a transfer and we say we can't take it for whatever reason because we're on a call, we don't have enough staff. It's been the hospital staff, like the doctor did today, got upset with me and proceeded to yell at me about the fact that he needed to take the transfer because they didn't want to send him on a helicopter. I have no control over that. I think it's smarter for us to send the appropriate care level with the patient versus just sending them. It's not safe for the patient, nor is it good for our personnel. And so I think all these things, it's good that we put these in the contract, because that's why we need a contract, because all these things will be outlined. It'll be as simple as the doctor determines that there needs to be a transfer, what level of care needs to be administered, whether that's basic or advanced level, which would be the paramedic or EMT. And then they call dispatch, let them know what level that is, and then the dispatch will make the call. Dispatch, the hospital wouldn't have to call our captains anymore like they've done in the past. That's where they've had the conflicts and the issues, that they're calling the captain and they're out on the call already, and it's already, their stress level's already up here, and now the hospital's calling them and saying they need to take a transfer, and we're like, we can't take the transfer right now.
I got
because
one
we're-
caveat to
we're
that. I
doing
know for a
something.
fact that the captains told them to not page and call them first. You can't have that, so you can't have both ways.
That's what I'm saying, we need to get rid of that.
Right.
Dispatch needs to be the one, they
Exactly.
call dispatch, they make one phone call, and then dispatch will determine, okay, Tremont's already on the call, we'll call Brigham City. Or we'll call Gold Cross if Brigham can't take it. Does that make sense?
Yeah, and that was one thing, and I'm not sure if I got that in here, but I think that we need to make, this needs to be a collaboration with the
Right,
hospital and
it
a
does.
positive experience all the way through. And so,
Totally.
if we can't provide that emergency transfer service or transfer service, we ought to be able to reach out and get someone to come in, or they should have the right to do so without any problems.
I agree.
Further down in section 3, okay, conduct a transfer risk assessment for each transfer, requested transfer using the objective checklist in the approval tool. And I put in Appendix B, you were talking about this, Captain, you were talking about some,
Yeah, and
you
this
could
I
use some
can't-
of
I
my
can't pull
ideas
up
or
on
some of
paper
yours, right?
Because it's in a tool on Google, like
Right.
I can't really
Yeah.
print it off.
So just inserting an assessment tool in here really helps out to
Yeah.
keep it objective,
Yep.
okay? Assessment shall be documented and shared with IHC within 24 hours of any decline or delay. Now, these are suggestions, that's all.
I don't see any.
Decline, delay, or accept transfers based solely on checklist outcomes, current staffing, training, and safety assessments with final approval from the Tremont Fire Department command staff if the checklist scores indicates high risk, okay? Provide the,
That again, I'm sorry to interrupt, but that again seems to put the final approval from the fire department command as to whether or not they feel comfortable and in a position where they can.
according to that assessment.
Checklist,
The
right.
checklist, right? And
So-
that checklist will need to be approved with the hospital
Sure.
in order to follow that.
Everyone knows where
Yeah,
everyone's going.
exactly.
Yep.
And I think that's great, but
I like that.
I'm just pointing out to the chief that this anticipates the concern about the captain being able to make that
Yeah.
decision. Fly.
Yeah. And that's what I'm saying, if we have this tool in place, we have the protocol in place, everyone understands it, it's not the captain just making a decision on the fly, the captain's following the protocol, and he's using the assessment tool. Is the weather conditions good? Are the road conditions good? Because we don't want to wreck an ambulance, which would then further injure the patient and both caregivers in the ambulance.
Most of the time,
Right?
I drove really crap. Most of the time, a helicopter can't go. They gotta go.
Right.
Yeah.
Got to
You
go.
take the ambulance, yeah.
So you have to.
Yeah.
But- and
That's
I'm-
why we bought 4-wheel drives and the whole.
But you see what I'm saying, though, we run a risk there. And so I'm not saying we
Right, but-
turn it down, but I'm saying this is,
So again,
that's a
this year-
scenario where you possibly could turn down a transfer.
This year, we've had year to date, we've had two non-transfers. Two times when there were times when they could have transferred and did not, for whatever reason. Out of the hundreds that we've
So it
done.
won't, obviously, hopefully it won't be happening very
Yeah,
often.
and that's my point, is it
But,
doesn't
I
happen
mean,
very
It's
often.
like being tired, being up. The 4896 it is what it is, and you signed up for it. So you plan on being up for a couple of days before you.
And
on
again,
most court.
here's the reason for adding 2 more personnel. If we do that, now we can rotate 2 more people into that
Right.
mix versus the 4. You get fatigue, the less numbers we have, the quicker fatigue comes into play. So,
Okay, last one on there, document all care rendered, including accompanying personnel and medications provided by IHC staff. And then let's move down further in the agreement, the next purple. These were some things that I think could be added, so I would suggest them to you. Quality assurance and dispute resolution. Some language in there to make sure that we're both on the page.
I'd just like to point out real quick, I gave you guys a copy of the policy that I wrote up, and it covers a lot of this.
Okay, well, I didn't get it until just now,
Yeah,
right?
yeah, and I'm saying that I didn't see this until just now, so
Okay.
I think we're thinking along the same
We probably
page.
are.
And, again, my first time writing a contract, so
Good for
I'm
you.
not a lawyer, I don't, you
Well,
know.
and our attorney will review.
Absolutely.
And I did have Dustin look over this contract, and he said it looked pretty good, but obviously it's not a final draft, so.
And then the last one's a contingency plan for unavailability. So that's where we'd go in and say, oh, we're not available.
We'd have
These
to
are the
contract
contingencies
with-
we have in order to make sure that someone is available.
Yep.
We don't want to leave someone sitting in that hospital that needs emergency
Right.
transfer.
And I totally agree, and again, back to the staffing, we don't want to leave our citizens waiting because we've taken every resource we've have and deployed it to the hospital. We want to be able to support our 911 service to our citizens. That's the most important thing to me, because this is a small percentage, 20% of what we're doing, or 30% of what we're doing, versus the other 70% of 911 calls that we have in the city for medical. And we need to be able to support that. And so that's where, again, the contract, if we were to secure a revenue source with them and it works out with the hospital, this would be golden, because it's going to help us to support what our goal is, and that's just to keep our citizens safe, right?
I think the hardest part for me, after I've been a fire chief for 14 years, is that it's a business and you got to think of it more of a business
Oh, yeah, that's what I'm doing.
than you were before. And I'm just saying
I mean, can you see what I'm saying
There's a whole
about
lot
this
of-
contract?
but there's a whole lot of stuff you think's the fire chief job that you wish was, and now it's all money and,
Oh, yeah, it's contracts, it's
recouping and-
negotiations, yeah, I got you.
well, I know you did it. I'm just pointing it out that
This is something I don't think anyone's ever even thought of. I mean, it's obvious. We're sitting here going, whoa, we never thought of this. You guys actually said that. And so this is something that I think is going to be a good thing for both the hospital and us. Again, as Brett said, it needs to be a collaborative effort. This is the beginning of what I can see as a beautiful relationship, as it was said, so.
I think it's a creative solution, and we just have some homework to do, and I appreciate it. That's where I'm at.
Appreciate it, thanks.
So can I make a motion that we table this resolution number 2540 until we further explore these other parts of the contract?
Okay, motion by
I'll
Brett to
second that.
table, and Bo's going to second. All in favor, let's see, this is a discussion. All in favor?
Aye.
Motion passes. Thank you, everybody. Discussion and consideration of approving ordinance number 25-15, zoning tax parcel numbers 050810016 and 051990003 as part of the LB Land Holdings annexation. Discussion on that, let's see, Jeff is on vacation. Bill, can you address some of this for us?
Yeah, absolutely. As requested by the council, we went back and got information from the property owners as to what they would prefer their property to be zoned as, and this is what we got back.
The property owners, this is what their suggestions.
Request is, yep.
Now, on the green, it was R120 before. Now it's R112. What was the reason for
That was their-
changing to
that
a
was their
small?
request.
Was it?
Yeah, that's it.
Okay.
What they said in that correspondence, I don't know if you saw in
I
the
read,
email,
yeah.
is that they feel that any bigger than R112 is hard to maintain. Usually get weeds, etc. That was kind of so just the increased size is hard to maintain, and it looks unkept.
Yeah.
So
All right.
I thought that was a reasonable, request on their part.
And I think as I recall, this was the request of the council to go back and talk to them, and they have now, and so this is what they're asking for.
And thanks for doing that.
Okay.
And it
Any
seems
other discussion on this?
I make a motion that we pass ordinance 25-15 zoning for them two parcels, the R110s and the R112.
Okay, motion by Blair. Do I have a second?
I'll second the motion.
Seconded by Bo. Let's start with you, Bo. No, let's start with Brandon.
I vote to approve, yes.
Bo, yes.
Blair, yes.
Brett, yes.
Yes, yes.
Perfect. Thank you, everybody. Motion passes. Discussion and consideration of approving ordinance number 25-16, amending the Tremont City Public Works construction standards and specifications. Carl, we've got him on double duty tonight. He is attending the mosquito abatement meeting. He's on that board, and so they meet every other month, and he's not able to be here tonight. So, Bill, can you address this for us?
As outlined in the resolution itself, the ordinance itself, rather, there are three things that were addressed in this. First is the sidewalk width went from 4 feet to 5 feet on most public roadways. This is in connection with ADA standards and requirements. Plus, it's just nicer to have a 5 foot. You ever try to walk with your wife on a 4 foot? You're like bumping elbows and things. It's awkward.
Every night.
5 foot's nicer. Limited pavement width in residential roadways. This state code changed recently to only allow a certain roadway width, and we've got that reflected in our new ordinances and our new standards, rather. And then a storm drain manhole, if a precast stone cone. What happens with a manhole is that the thing that you see on the top flares out pretty quickly into a cone shape that allows for ladders and other things to get down inside there. So if those standard-sized cones don't fit, we've got now we've got a standard to address those kinds of concerns as well. Other than that, the thing that developers, contractors, and construction people, the thing they crave most in any of these processes is predictability. They want to know what the requirement is, and this helps them get there. It reflects some of the changes as mentioned, but also really just gives the developers, this is what our standards are, please build this.
And consistent.
Yeah.
Can you go into a little bit more detail on bullet point 2 on those limited pavements? That seems a little vague, and I think the citizens would like to know more about those numbers.
The explanation itself is a little bit vague, but if you were to go down to the different details as outlined in
Those diagrams.
the different diagrams, the state code changed to allow only a 32-foot maximum pavement width a couple of years ago. This is a reflection of that. So on neighborhood roadways, you can still, where we have like a 60-foot right-of-way, the maximum pavement width in those areas is now 32 feet wide.
What was it?
I think probably 40. I don't remember exactly, but I think it was 40, but state code narrowed it down to 32. This is a reflection of a couple of different things, but it's in the city's favor because it's less asphalt for us to maintain. So,
A lot of communities have done this already.
yeah, they have to, we have to because of state code, but it's the plus, the boon for the city is that we've got a narrower asphalt square footage that we have to maintain long-term.
One of the concerns was, emergency vehicles. Is that addressed, and is that a concern for us?
Well, it's always a concern. Typically, what happens on a pavement like cross-section like this is that you have 24 feet as a clear drive aisle for emergency personnel, and then you would restrict parking to on-street parking to one side of the street, so that you get 8 feet for that parking area, plus the curb, which is another 2 feet. Or the gutter, rather, the curb and gutter is another 2 feet. So you've got a full 10 feet on one side of the road that would be for on-street parking. That leaves 26 feet of asphalt on the opposite side of the street, free and clear for emergency personnel. And that, unless I'm mistaken, Chief left, that's what the fire apparatus, that's what they look for, is that 26-foot clear drive aisle.
Are we going to have issues with people parking trailers and things like that?
Probably.
That is an
Yeah,
issue that I
probably.
think we need to,
It would be an enforcement question. It would be an enforcement question.
Yeah. Yeah, it's already an issue in some parts, and we need to address that.
Yeah, for sure.
But with the state pushing this down, we're pretty well required to do
Right.
it,
Yeah,
correct?
there's not a lot of wiggle room on this. It's a boon for the developers because they have to install less pavement, right? But it's also a long-term legacy cost that cities have to bear. So it's probably a good thing.
All right. Any other questions on this ordinance?
No, it's very thorough.
You ready to move forward?
Yeah.
I don't like the idea of narrowing our streets, but if the state's mandating it, we don't have much choice.
Yeah, I mean, do we have the option not to on the narrowing?
Well, if it's if the state is requesting.
Yeah,
it,
that was
it's
my
fine.
research. Exactly.
There's no option.
Yeah.
We have to do it.
So
hate
we
saying
probably
that, but-
shouldn't have to approve this then if it's a,
Well,
right?
it's part of
Other things on
our
standards.
adopted standards, so.
I'll motion that we approve ordinance 2516, amending the Tremont City Public Works construction standards and specifications.
Motion by Bo. Do I have a second?
I second it.
Seconded by Blair. Let's see, Blair?
Or yes.
With my arm behind my back, yes.
Wes?
Me too. Wes, yes.
All right, Brandon?
Yeah, it's a yes for me.
Okay, thank you, everybody. I think I got everybody, didn't I? No, I didn't get you.
Oh, yes.
Okay. All right, motion passes.
back.
Thanks, everybody. That concludes our new council business. The consent agenda, adoption of the June warrant register, and adoption of the June financial statements.
I have a question about this.
Sure.
Can we open a small discussion about it?
Absolutely.
I think, how do we, financials are available to the constituents. Oftentimes I'm asked questions about those financials, specific questions, that I don't know the answers to. Would you like me to address them straight to you, or
Yes,
what
that
would
would
be
be
the
preferable.
best avenue? Okay, because I think there's quite a few of them. You know, one, for example, was Utah Jazz. There was an expense for $15,000, and I would assume there's offsetting revenues to go with that. That was my assumption, but I didn't know the answer to
That's
that.
a correct assumption. And if you look actually at the item here on page 90, it's on page 77 actually of this, of the,
Warrant register.
packet.
Yeah.
It's page 1 of the warrant register, but it's the page 77 of the packet. It's the second from the bottom. It's $15,353. I think that's the concern. If you look to the right of that, this is Junior Jazz membership and
Yep,
tickets.
that was what I was.
So
That's
that's-
why I
when
considered there
when
was
kids sign up and-
offsetting revenue.
Yeah, I checked
Yeah.
with Zach on this, and when kids sign up for Junior Jazz, they pay this, and then we remit that back to the Jazz for licensing agreements and everything
Correct.
else, so.
Okay.
Yeah, so this includes, so this is all user fee paid for. So this includes their membership in Junior Jazz, which Junior Jazz is the largest youth basketball organization in the nation. So being part of Utah in our community, being a sport-oriented community, they want to be part of this. And we have 800 kids that are a part of that. So this includes their membership, it includes their jerseys, which would be similar to us going to Cover Up and purchasing jerseys like we do for flag football or youth soccer. It includes the optional tickets that they buy to go down to a game at a discounted cost. And then at the end of the season, we have to pay our share for the equipment, for the jerseys, for all that stuff. So it's just our fee that we owe them for
That's
that.
kind of what I was thinking.
Yep.
I kind of like the idea of somehow showing the offset, and maybe there's something in the future where we can get to where we're showing the offset but yeah.
I have those numbers in total. I don't have them with me. Junior Jazz for 800 participants, we bring in $70,000 ish. But our expenses are usually around 65, somewhere around there.
So it's a a little bit of revenue source.
Yeah, so we've created it and we've adjusted things. So we used to be in the hole in that one, but other sports subsidize that. Our recreation program hasn't been in the hole. We always make more than what we spend on that, which is why our recreation fund has grown to 400,000. Where we're at now. So, yeah.
I guess, yeah, so that's just the question is I had trust that that was the case. And yeah, in the spirit of transparency, want to make sure that the citizens feel open to asking those questions and understanding what they are. So maybe that was more it. It's just I have a high level of trust personally for our city employees and the job that you guys are doing in managing your budgets. And yet I also want to make sure that we, give the community an opportunity to get those questions answered in the best way possible. So that's kind of just, if we have a way to open that up and be transparent in a way that is convenient, and maybe we let town halls give us more feedback around those numbers and.
Sure. We are doing the best that we can to get these numbers out there. We're not trying to obfuscate anything or operate in any way that feels confusing or we want to be responsible as well. And so I think one of the concerns may be that let me just give you an example, and this was brought up by a council member who may or may not wish to be brought forward, so I'm not going to say. But the Zions Bank Card Center for $37,596.62. It's on what page is that? Page 3 of the check register, the warrant register. If you look over to the far right on that, there's 147 items that we bought. The one that's in there, it says printer ink cartridge. We didn't spend $37,000 on a printer ink cartridge, but the space only allows populating one item in that of the 147,000, or 147 rather, that we purchased. So if you were to scroll down just a little bit further on this is where you get to page 91, I believe, of the packet. You'll see that the Zions Bank Card Center, that's the 10108, there are items, and they're all broken out according to what we bought and paid for in that 37,000. And if you look, there are things that we purchased from Amazon, and the very last item on that page, and it's long, it goes all the way to page 11 on that, is that printer ink, and that is 147. So that field up above populates with that very last item, and it looks like we spent $37,000 on printer ink. Well, we didn't. We spent $60 on printer ink, which we have many printers, and some of them are big and expensive, so they take expensive ink. This is a very detailed explanation of how we spent that $37,000. This has been available, Cynthia, what did you say this, we've been publishing this for 10 years?
Yeah.
Yeah, so a long time, a decade or more of this information being available to the public in these staff reports, in these warrant registers and consent items for more than a decade. If there are ways, and certain council members, nameless, unless he wishes to identify himself. Brett mentioned that there could be ways that we could more creatively and more proactively get this information out to the public.
Yep.
But it's out there right now. It is available, and if people care to question, we have department heads and staff who are available who would love to answer questions about this.
And that's what I wanted to open the discussion up for, is like the Utah Jazz, that I think if there was actually an offsetting income that was greater than, so it was a net positive with that expense that was associated, and I just think it's important that we can
tell
get that
narrative.
information back out, to anybody that has questions. Because, I don't blame constituents for having potential mistrust in government, and we
Absolutely.
want to be transparent and
Well, and especially if you look just at the warrant register, the check register, and saw $37,000 for ink, what are they doing over there? And then that would be confusing.
Right.
You have to delve just a little bit further, and the information is published just a few pages down. But if you stopped there,
Yep.
you might freak out going, what's going on at the city? I want to work at the city. I want to start selling ink to the city, But you got to look just a little bit further and find that information, and it is there.
Part of transparency, though, is it's not this standalone virtue, right?
Yeah.
It's we identify these so we can see them, but it's still a little bit hard for people to see it, and we can do better. And so, what
can I ask a
transparency-
clarifier on that? Like,
Uh-huh.
in what way? What?
Well, for example, how can someone there are programs out there where a person can go in from the public and click on the register, click on this, it will bring up the transaction and all the information will be on there. That's pretty transparent and make it really easy for them to get to. Now, this may be sufficient, but my only point is if we feel that this isn't giving the information out there, then there may be better tools that we can provide. I don't know.
And it looks to me like it's a little bit of an educational process too. If there's just being able to navigate through these financials with a little bit of effort and a little bit of maybe just better understanding of how they're put together, probably just answer a lot of those questions that are out there. So, I don't know if it can be fine-tuned a little bit more. I don't know if is it the Cassell program that does all of this, and I don't know what flexibility that program has to.
Feels pretty transparent to me.
It looks, that's the way I think.
Well, I think it is too, and I think that's where I say the educational part of it is just knowing how to navigate through this information and
I think
getting
that,
that.
I think that maybe this addresses Brett's point a little bit, is that you look at, and this is on page 9 of the report. It's on page 89 of the staff report or the packet. There's an item for apple.com, and it's $10. And I think someone might look at that and think, oh, the city's paying for someone's apple.com registration or something like that. And we are. But it's at the library, and it's used for everyone that goes to the library. It's used by our residents. There are certain programs or apps or things like that that can only be used if you have an apple.com ID and registration. And so we pay $10 a month for that, and we get benefit for everyone that goes to the library.
Well, and I guess that's what I would like to get to is do other cities have like a question answer location where they can ask the question, get the answer? Because usually it is a simple assumption,
Sure.
right, that has been made about misuse, and it usually has an answer. And so I just would love to.
I believe the answers are there, and
Yeah.
like this apple.com question, I know that has been a question maybe, but if the solution is that simple, why wouldn't we say that? I mean, that's clear. And if there is a problem,
We want to know it anyway.
know that too.
Yeah.
And no matter if it's $10 a month or if it's $37,000 for ink, if there's a resident out there that knows that we're paying $37,000 a month for ink, but has a better solution to that, let's get that out there too.
For sure.
Yeah.
I am the only person that spends money off my credit union account, and I go in there all the time thinking, kid, somebody ripped me off. And then, oh, yeah.
You're
I
like,
did
oh, wait,
that."
it was me.
Yeah. So it's,
Is there any way, the only thing I could think that would make this even easier is if they had hyperlinks or something like that you could click on it and it would take you to that transaction. Is that even easy? That's not even possible. Okay, that's just a question.
Department heads have that, but we pay for that, so every person would have to have a license to sell. So
Okay,
I think if they have an avenue, if it's a red flag, they could call somebody.
breaks it down better.
And there's another website that it's called opengov.com.
Which website?
Opengov.
Transparency website.
Oh, yeah.
Put all of our expenses and payroll up there every year.
And it does have more.
Yeah, it's kind of hard for my phone right now, but it's bringing up individual checks who it was to. Maybe doesn't give a description, however, of what it was for,
But I think there's software out there that allows for a little bit.
It's just whether or not it syncs with our current accounting
Correct.
software, right? That's the main thing. Without substantial additional
I
effort.
want to say, just for the record, that and I'm speaking for myself personally, but these funds are sacred to me. And if there is any way we can either work more efficiency into them, go without, do things in a way that preserves and conserves as much as possible, that's what I want. That's my goal and my aim, and I know that's the same for every department head in the city. We're always looking for ways to build efficiency into the system. We want to be transparent, we want to be clear, and we want to hold these funds sacred and use them in a way that is respectful and honoring the sacrifices that people make so that we can carry on the business of the city. That's my priority, that's my goal, and that's job one for me.
So if I can, just go over a few expenses. Do you want to explain the Jones? I just picked off some really high number ones, but Jones and Associates for
Yeah.
36,000?
Again, this is our city engineer. A lot of his costs are passed through. This is broken out in, on page 4, starting at the bottom of page 4 and going through page 5. Everything that you see that's associated with a subdivision is as a pass-through expense that's paid by the city, but then we charge the developers this fee. It's for reviews of these subdivisions. That's all in there. There are things on here that are projects that the city pays Jones and Associates to review. For example, there is the ASR project. It's the fourth from the top on page 5, the ASR pumping project. You see that there's $1,100 there. That's for their review of Horrocks's work. So Horrocks is also one that I know that we had talked about, Brett, that was a larger expense item on here. This isn't, that's for the ASR. That's being paid by that grant that we got. And this ASR pumping project on Jones and Associates is the city's review of their work to make sure it was done accurate and complete.
And that's covered as well by the grant.
No, this one wouldn't be. This would just be us paying for that.
But Horrocks was.
But Horrocks, in its entirety, would be, yeah.
Okay. Now, I ask these questions so that we can educate the public.
Yeah, for sure.
I know the answers.
I know you're not grilling me.
Okay.
I'm good.
Okay. I want to give you an opportunity to explain the Tremont Center LLC for $600,000.
Yes.
Could you take a minute and explain that expense to the
Yes,
public?
absolutely. So that is paid for the development of the property that, basically, they filled in the canal, they put that new pipe in the ground. The box culverts, yeah. And that way, that opens up that entire area for future development and makes it possible for access onto the road and everything else through that area. So without that, the area would be landlocked behind the canal and not developable. It was one of the projects that was specifically and explicitly outlined in the RDA and the CDA when that was formed. And the funds have been expended. The pipe is in the ground, and the developer has asked for reimbursement. That's what this check is.
And so where did those funds come from?
Those funds come from the RDA, and they are paid for by the RDA, not the general fund or not through additional tax revenue. It's paid for by the RDA.
And then I think it's important that the citizens understand where did the funds for the RDA come from?
Okay. That's a little bit of a longer explanation. When you set up an RDA, you establish what's called a base year. And through that locks in the taxes at that level, okay? Once you've locked in the taxes, let's say the property is worth $1,000. It's not, but let's just say it's worth $1,000. That's the taxes that you would normally have received at that base year. it's anticipated that through development of the property as well as through natural market increases in the value of the property, the taxes will go up. The value of the property will go up. The difference between that base year and what the valuation is in year X, 5, 10, whatever, that value goes to the RDA. So the county still collects taxes on the improved value, but instead of that going to the general fund, like normal property tax, that goes to the RDA for use in the RDA area.
And that includes taxes from all entities, or most entities. For example, the school district and,
That's right.
and our property tax.
County
and-
taxes.
And whomever, I guess they can be kind of specific in who they ask to pull it from.
I think it's all the tax.
Is it all?
All the tax.
Yeah, they all pay into that. But they don't pay into it. What they do is they forego that additional value, and that additional value goes into the RDA. So we're not losing any tax dollars. And then once the RDA's term is complete, we're getting the full value of the market value increases as well as the property improvement increases on the property.
And that RDA, this particular one with the Main Street, that one matures 2030.
Yeah, it's pretty quick.
34, something like
34?
that. 30 or 34, somewhere there.
And then, but it's actually ahead of schedule.
Yeah, so we could pay that back. We could pay the developer back sooner rather than later, and then the RDA would just collect all of that money.
We're
between
coming
that-
on the tail end of those payments. if
Yeah,
I
between
understand
that, the end of the payments to the developer for the approved projects, and between that time and when the RDA reaches maturity, there's still some RDA funds that could be available that would be used in the RDA area for improvements
And-
at the discretion of the RDA.
And from a standpoint of being transparent, what we're talking about here is these RDA funds must be expended in the RDA area.
Correct.
Not, it can't be used willy-nilly and just wherever we want to in the city. It's got to be done for Main Street or this area that is in the,
Correct, as
CDA.
determined by the RDA.
yeah.
Thank you.
You bet. Other questions, other thoughts or concerns?
No, there was one other expense that I wanted to bring up, was the Amazon Capital Services shipping for $2,300. What?
Again, look down below, it's not just shipping.
Okay,
That was the last item.
okay.
I think it was books from the library. It is books from the library.
So the
Okay.
library, and again, a lot of times we'll subscribe to Amazon services because we get a discount if we subscribe to the thing, and it has to go through Zions Bank card.
No.
One additional thing that I wanted to mention, though, in passing, is that in signing up for the Zions Bank card, we do get some cash back for these expenses and things like that. So I forget what it is, 1% or something. It's not huge, but it's better than nothing. So
Yeah, maybe social media, we could just do a quick, hey, just while you're reading the financials, if it says this, down below it says that.
Look
you know,
down
just a
below.
Quick explanation,
Yeah.
you know,
we're
because
not paying $37,000 for ink.
Yeah.
It's
just to clarify it, might not hurt.
And I'm sorry, I got three little suggestions, if you will. When I worked at the hospital, and Brandon may be able to back me up on this, but credit cards, boy, I think the administrator was about the only person that had a credit card. No one else had them. We did most of our purchases through a little bit more accurate accounting system, if you will. Credit cards seem to open it up for a lot of red flags. What's your thoughts on that? And is there a way that we can somehow take a look at how many credit cards we have out there and a better way to follow that system and making sure that we're being accountable for all those expenses? Maybe we have something that says anything over $500, we do a purchase order, or, you know, some other system. I just get concerned about 147 lines of expenses and 36,000 this month, but there's been a lot more in past months, and that just opens up for some issues, some red flags if we're not careful.
Sure.
Credit cards
They're
do.
still on there.
Yeah, they're still there.
A PO is required for every purchase ever.
Even a, even a credit card.
Absolutely. We
So
have
when-
to have something to reconcile the credit card.
The auditors check every single credit card statement. It's like this thick each month, and they go through it
All of
line
them.
by line and ask for every single thing.
So I'll just give you an example, and I think we talked about this. When at Heydays, the little connector for the propane tank was broken. So I ran over to Greer's, grabbed one off the shelf, pulled out my card, bought it, brought it back, saved the day. I'm the hero, thank you. But if I didn't have the card, it would be difficult for me to do that, right?
Yeah, charge accounts, I mean.
Well, they do have a charge account. We do have one at Greer's as well, but I didn't know what it was. I was in a hurry. We were just, here's my card. When I got the receipt, I held onto the receipt. I brought it home. I'm required to hold onto the receipt. I filled out a PO form, gave it to Tiffany. She cross-checks it, makes sure that it gets filed correctly, files all of that information for the auditors. And if I didn't do that, I'm held responsible for that $10.50 that it took to buy that part. And we can make a receipt, we can, there are ways around it, but it's better just to hold on to the receipt, fill out the PO, give it to Tiffany, and it's all good.
And maybe I'll mention too, as part of GASB, they're actually doing an audit on our internal controls every year. So when they give that reporting, they're saying that, they've analyzed our internal controls and we're within the GASB standards. So that's something that we should also have some confidence that they're kind of dotting the I, crossing the T. That's why they're there. That's why we're required to pay them to do a GASB audit.
The other thing I would mention is that we do have fraud controls through credit card uses, especially for online purchases where who knows who's looking over your shoulder and grabbing what information. We do have fraud controls in place for that are only available through credit card use. And some places like Amazon or other things like that will not take a check. You have to have a credit card. And as you can see, we use Amazon quite a bit. So I think I know where you're going with it. We need to make sure that we're using it appropriately. It's a tool and not using it frivolously or without some policies in place. But we do have purchase policies and procedures in place. They're in our code. If things are above a certain level, they require department head approval. If they're above another level, they require the city manager's approval. If they're above that level, then they require the city council, even if you've already approved it in the budget. And, we have to go out for bids. We have to get 3 competing bids. All of this is governed by our local ordinance as well as state code. We're trying to abide all of those things.
I guess my discussion, the only discussion I was trying to have is, like at Intermountain and other large companies like that, they just don't use them. And so why would they not use them and we do? You know what I mean? Is there
It's a
some
good
better
question.
practices or some things we can learn from these other companies that make
Or maybe
sense?
they could learn from us.
I don't know.
Maybe there's.
But
Yeah.
we actually,
Have a lot of.
we've lost,
Maybe it's changed.
yeah, it's changed dramatically.
Okay.
We just have a lot of checks and balances now, and I know you're not suggesting this, but we also, I think if we hire the right employees, there should be trust that's there, that's well established. And, you have to account, like I'm on a business trip right now and I have to have my receipts. I have to turn those receipts in. I have to document why did I make the purchase? And I think once the staff members, they're following those standards, then you shouldn't have any challenges.
They still have to answer for their budgets at the end of the year. So even if they're using
Yeah.
credit cards and they overspend, they've got to answer for that. So they know they have their approved budget.
Yeah.
and they're over that.
Well, and I think I'm asking these questions so I can learn a little bit too, because it's been a few years since I was in that industry, and I know that credit cards are relied on a lot heavier than they used to be. So,
I will say we used Curtis extensively. When we started this, it was because some purchases required credit cards. Like you said, there's some items that they just need to purchase online. So we went through this with Curtis and said, who should have credit cards? We'd like to know, there's 22 people. Department heads all have one. There's a couple other people, the sergeants have them at the police department. Rusty just barely got one, so we don't just hand them out to everybody, but with Paul Vaughn, Rusty took over maintenance for the building, so he now has a credit card to buy cleaning supplies, toilet paper, all that kind of stuff. There's not a lot of them, I mean, it's department heads, and like I said, the sergeants, the senior center activities director has one, cause she takes one field trip, so. That's,
I won't be surprised if we're transacting on the blockchain soon. So as a record of note, it's going to happen probably. So
Yeah.
we just got to stay on our feet, agile with internal controls. But again, that's what the audit does is audit that.
It's that check. That's the great check at the end of the year.
and 2 people check every PO. Tiffany checks those, I check those, the treasurer checks the amounts, so.
Okay.
Part of the gas fee, like you said, that's part of our policies.
Great. The only other one I had was on landmark design, but they're kind of questions directed towards Jeff, so I'm going to hold those off until he's here.
Okay, just so you know, landmark design is Sam Taylor and his
I
group.
know.
They're working on our form-based code
Right.
and Main Street redesign and stuff like that, so.
But in all fairness, it'd be good to have him here to answer those questions,
Yeah,
so
that's fair to him too, I think.
I'll wait on that. And I'll shut up now.
You good? All right. So we have a consent agenda before us. If there's no other questions on the warrant register or the financial statements, we'll entertain a motion.
I'll make a motion, we approve the consent agenda.
Okay, motion by Wes, second by Blair. All in favor, say yes.
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 Any opposed? Okay, motion passes. Thanks, everybody. Calendar items and previous assignments. Review of the calendar. Coming up, we have Saturday, we've got the Friday, pardon me, the farmer's market, and Saturday, the Get Out event. Hopefully this time, we've got produce. It just takes that long for the produce to become available on these farms, so that's hopefully the case. Primary elections on the 12th. We're looking forward to that. And then we are still, I know there's some questions on the All Horse Parade. We'll go ahead and I know we may discuss this a little bit later, but we are working on an MOU with us in the county. I know the issue is liability and everything, and we're addressing that concern and with the county and our police department and sheriff's department and so forth. The county fair, 17th through the 23rd, and next council meeting on the 19th has been canceled and rescheduled to the 26th. So that's an important. That's because of the canvass for the election is going to be due by the 26th, and the council will need to review the results of the elections, and that'll take place on the 26th. And so in September, we haven't got a date on that yet, but we want to have an open house for the for Main Street Design. It was mentioned a little bit about Sam a minute ago, and Chris and all the others. We hope to have have everything laid out so that we can have you'll be able to come and you'll be able to see the intent for the Main Street Design coming up. I know the Main Street Steering Committee is working in conjunction with Sam and everybody else to try to come up with this design and ideas for it. And then the idea will be that the public can kind of put their input into how they want to see it, fine tune it and everything like that. So.
Are they working to a budget on that, or are they?
Yeah, yes. So after the first of the year, they hope to have, that budget will be part of this, what we're going to be talking about with the open house. And then if everything comes to plan and we've got the funding for it, they hope to put it out to bid after the first of the year.
But I mean, they got a budget they're working to, not just this great plan that we can only afford a third of it type thing.
Yeah, they
You know what I
are.
mean?
I think it was based off our previous conversations around budget on Main Street, right?
Yeah.
And that's what they're working to.
The feeling is that.
They're working on phase one.
Yeah.
Yeah, the money is there to do phase one or phase two, however you want to look at it, but to get something started with the Main Street, we've got the money in the RDA currently to do that, so. So anyway, that's, guess we can talk about the, anyway, just a reminder about the farmers markets on the second and the fourth Fridays, and the Get Out on the event on the second Saturday from 10 to 3 at Schuman Park. So that kind of goes over I think I lost my, that kind of goes over the agenda a little bit. Any questions with any of that? When do we have the fall League of Cities and Towns?
First and second.
It's a little late this year. It's usually in September, but they're
Well, it's going to be later this year. All right.
It was brought up a few weeks ago, or in one of the things about the Get Out and Farmers Market, trying to bring them together so that we had food trucks on both nights and all that combined. Where are we at on that? Zach, what did you figure out on that?
I know Kai has been working on that. We just put out a mid-season survey to ask all of the participants in both of them their feelings on how the season is going. I know she's mentioned that she's asked different vendors how they feel it's at the farmers market, how they feel it's gone compared to at Midland Square. A lot of them feel that their sales are similar to when it was at Midland Square, even though the perception is that there's less people. And their thought is because it's so much more spread out, then it's not condensed, so it feels like there's less people, and not as condensed so that it feels more vibrant more. So that's what I know on that. I don't know on the survey if she's gotten any responses back. I know she just put it out, I believe last week, Friday or so. So I don't have any response on that survey.
Yeah, so the farmers market does not take place on Saturday.
So just Friday.
Farmers markets are Friday. So originally the farmers markets were on Midland Square. The feedback we got from previous farmers markets is they wanted them more frequent. So we went to 2 times a month. And the other comment was, this is just a vendor fair. And it's there, where's the produce? Where's the food? And so we made it only perishable goods and produce. Now that the produce is starting to come on, we hope that the attendance picks up for that. But the structure of these is based off of previous comments from past vendors and things.
So when's the last one? Is it next month?
October. So it goes May through October is when they've gone.
Yeah, I would just suggest that we look at a different model in the future of maybe not farmers market and Get Out, but Get Out of the farmers market. I mean, all one thing, and just let people participate in both days, because then they get a lot more frequency.
And that's what
we get a lot more people there,
yeah,
right?
and that's what we put the survey out for, the mid-season survey, to get that interest on how the vendors feel about those. And then as we move forward into the next month, we should be able to make changes if desired by the vendors.
Thank you.
All right. Any unfinished business that we need to address this evening? Okay, hearing none, let's go
Well,
on.
can I add one thing to the calendar? Remember, this Wednesday night is the Truth and Taxation for Box Elder County School District.
Oh,
At 6:30.
Thank you for bringing that
So
up. Why don't you say that one more time so everybody?
This Wednesday, 6:30 next Wednesday at 6:30 is the Truth and Taxation for Box Elder County School District at the school district offices in Brigham.
Oh, great.
So anyone that wants to participate in that, go listen, please go.
There you go. Thank you. All right. Administration reports. Bill, do you have anything for us?
A couple of things. First off, we talk a lot about what makes Tremont a community of distinction and a wonderful place to live, the quality of life that we enjoy here. And there are a couple of different things that I wanted to point to tonight. First off, Heydays, what an amazing thing.
Yeah.
What a great turnout. What a great fun event. Zach and his crew and really everyone involved with that. What an amazing, beautiful, just fun thing that we do. And that's part of what keeps Tremonton amazing. And everyone from the volunteers and the youth city council, all the way up through the staff who gave of themselves their time. Nick Nesson, Officer Nesson in there slinging sausages and just having fun doing that. To the council members who clearly care about their community and are out there cooking hamburgers and hot dogs and eggs and pancakes. What a blessing it is to work with such amazing people, and I'm grateful for that. The other thing is, and we don't often talk about the Public Works Department a whole lot. These guys, and over the last 24 hours, I know there have been some major water breaks. These guys are there until the job is done. They're down in the ditch. The water's cold. It's miserable. It's hot. Like their heads are sweating, but their feet are freezing in this water. It's miserable, thankless work. But they do such a good job that people literally come in from other states to see the work that they're doing. The mayor and I were happy to help host the mayor from Afton, Wyoming, and their city administrator and public works director who came in to see our operation down there at the treatment plant. And what a treat. Our guys down there they're second to none. The quality of work that they do, their intelligence, their capability, we don't think about it. We don't think about what happens when you turn on the water. You just expect it to come on. And if there's something wrong, you expect that people are going to show up and fix it, and it'll be a temporary thing, and you'll be back to water. Conversely, when you flush, you don't think about what happens on the other end. But these guys do. And I mean to tell you, it's thankless, miserable, stinky work, and they're doing it every day. Every day. And what a joy it is to be associated with these incredible, motivated, dedicated individuals who give of themselves so much. Just can't commend them more. Carl and the whole team down there, what a blessing and what a thrill it was to show off our city and the great work that's being done down there. And that's all I've got for today. I often talk about how amazing it is to work with these individuals, and I could not be more blessed and happy to have an amazing team, an amazing crew.
I second that. DRC?
Nothing from DRC, except to say, we meet every other Wednesday at 9:30 in the morning, and you guys are welcome to come to the DRC meetings if you would like. The agendas are published, and if there's something of interest to you, anyone in the public is welcome to come and view that and see what's going on, what the developments are in the city, and it's a dynamic, growing time. So if there's any interest on anyone's part, please come out. Please engage yourself and come out to those meetings, and yeah.
Do we have any updates on the facade and, standards for Main Street? How's that project coming along?
Working through that with the Main Street Committee
That's
right
what
now.
this open
Okay.
house will address, all of
Yeah.
that.
Excited for that.
Yeah, it's going to be good.
Jeff?
Okay, I apologize.
Oh, I'm sorry. Did
sorry.
you have anything else?
No, that's it for the DRC.
Okay.
I apologize. I completely forgot about something that was like way more important than my presentation, and that was a citizen award. If Remington Sano and his family, or if Remington wants to join me up here, that'd be awesome. So back on July 6th at our Maverick here in town, Remington is one of the employees there, and he's 17, correct?
Yep.
Remington? Yeah, he was out kind of doing his rounds on the grounds of Maverick, doing his employment opportunity, or things he has to do there as his opportunities as an employee. And he heard his manager yell, "Fire." And when that happened, he turned and realized that one of the cars that were sitting at the gas pump was on fire, it was smoking, active flames. And without even thinking, Remington turned around as his manager went to shut off the gas pumps and call 911. He ran directly for the extinguisher, ran out to the car, and proceeded to put the car out, and before we even got there. And so he saved that gas station from possibly explosion. and so risking his own life to do so. And so I wanted to thank Remington for his outstanding service as a citizen here in Tremont. Fire department patches and our challenge coin and a little cloth there to clean the coin and your
Thank you. I
eyeglasses
appreciate
if you
it.
need to. Thank you, Remington.
Thank you.
for your
Thank you, Remington. Very good. Well done.
Plus, he sat.
Way to go.
He did. And that's what I apologize for. I totally
I kept looking back there to think,
I forgot to get him on the list at the beginning of the meeting, and that's my fault. I'm
and he,
so
and
sorry.
he sat through the whole thing.
Got through the whole thing. He said it was interesting, so thank you for entertaining him and giving him some food for thought, so.
Thank you, Remington.
That's awesome.
Do you guys want me to report as well?
Sure, while you were up there, why don't you go ahead?
That was pretty much it. You heard the contract thing. We're continuing to push forward. We've been fighting a few grass fires, past few weeks since our last meeting. We had quite a few of them. But we've kept them small, which is a good thing. And we're just business as usual, so.
Okay. Thanks for all your work.
And we've hired a new captain, so fully staffed, with full-timers, and, he's a paramedic, and so we were able to jumble some people around, and we still have one medic on each shift, and everything's good, so we're moving forward.
Great. Thank you so much. Zach, you sat through, we were going to put you on the workshop during the work session, but why don't you give us a little recap of Heydays?
Okay. Do you have that video? With our work with Bear River Live, they made a recap video. I'll have Cynthia share that with us while I hand out this presentation, which we'll also show. You guys are a bunch of tricksters because I didn't know what was going on earlier. So it's a little ruse to get me here.
It's your video.
We don't need to. I'll just go over it. Yeah. So I don't know if Mayor really wanted to know or it was just to get me here for something else that I had no clue about, but I appreciate that. But yeah, so here's our Heydays report. So Mayor did ask me to do a little report last week right after Heydays. So I did get more numbers and was able to finish this up today. But Heydays was held on the 25th and 26th to commemorate and celebrate our rich agricultural heritage here in the Bear River Valley and to foster our community spirit and to bring the community together as community events should do. So based off of last year's numbers, we had Placer AI last year. So we knew that last year we had around roughly 4,400 people that came through Heydays. This year with the increase in numbers at the community dinner, at the breakfast, and just the overall feel throughout the day, I feel due to weather, it was in the low 90s instead of 105. Our estimate is that we were around 6,000 attendees throughout the 2 days at Heydays. So it significantly was higher than previous years. Not only last year was 105, but the year before that was in the hundreds, and the year before that was also in the hundreds. So this year was great to not have the blistering heat. Live music and entertainment. We worked with the library to bring a ventriloquist as our entertainment for our Friday night show, which was fun for the children. They had a good time there. Then we followed that up with a movie in the park called Wicked, which is a spin on The Wizard of Oz. We set a new policy that we will no longer show movies over an hour and 45 minutes long for our movies in the park, because we were falling asleep by the end of that. So it's a 2.5 hour long movie. Saturday we had a cowboy poet come with he and his daughter, and they provided music, and that was a good addition during the day after the car show and after the baby contest to have that additional entertainment. And then the Magic Man always brings his own crowd. It did get windy right at his portion, so it was a little difficult for his magic, but everyone still enjoyed that. And then we ended up the night with the concert and the fireworks show. For our vendor market, we had 60 booth spaces that brought local businesses and artisans that showcased their goods. And for children activities, we had the bounce house that on Friday night goes from 4 to 9, and then Saturday almost all day. There's a 2-hour break during the day, during the heat of the day, to give the staff some downtime and a break, which was good because that was the windy portion that they would have had to shut down anyway. They ended up opening half an hour later because they weren't able to start because of that high wind. We also started a bubble party and a water fight that attracted a lot of families over to that. And then later in the evening had a kid bike parade, which a lot of people came in their bikes that they decorated. And one kid dressed up as a spaceship, which ended up winning the bike parade and being the grand marshal for that. Teen activities, we had the Gaga Ball Pit, which is always a huge hit with the teens. They're in that pit constantly. I don't think there's an hour as soon as it starts that it's empty. And so it was so used that they did wear out the grass, and we'll have to look for remedies in the future, moving it more often, possibly like we have in the past, to preserve that grass in the future. We also looked for new ways to bring the theme to life. So we added the cowboy games, which was some dummy roping on some hay bales. We got some bouncy horses that, again, just like the Gaga Pit, they were used almost 100% of the time when they were out. And then the long games are a big hit as well, with the axe throwing and the cornhole and the spike ball. For contests, we started off with the Heydays men's softball tournament, which is the weekend before that. We moved it due to the heat that we've had the last 3 years, over 100 degrees. We made it an all-night tournament. So we started at 9 p.m. and we went until 7 a.m. And we had a lot of great feedback about that. The only negative was 5 p.m. For the championship game. Everyone was dragging their feet, which is also good because that causes less arguments during championship games because they all just want to go home and go to sleep. So we had 6 participants for that, and so we're looking at keeping that way in the future. We also added, the home run derby that has typically been associated with the softball tournament. We brought it to Friday night during the evening, so they're doing it a little bit under the lights. Men, women, and teams are able to participate all together for a chance to win some awesome prizes that we have out in the field. We had 47 out of 50 spots filled, all with local participants. So it is another thing, being a sport-oriented community, to add to Heydays, and we got it in the right spot now. The Heyday 5K had 96 participants. We started a grass volleyball tournament that had 5 teams. The car show brought in over 70 vehicles, and which I think is significant because we had 2 other car shows within the region, one down in the Layton area and one over in Montpelier, which is the Bear Lake car show, which is a very large car show. The baby contest had 51 babies on stage, and then the Guns and Hoses softball tournament. Sorry, Chief, I don't mean to bring that up, but did you guys get your trophy?
fire department didn't even show up.
I know, yeah, only one team showed up for that.
I heard there was some cheating.
That didn't make it to me, but but yeah, so we have an annual trophy just like the Stanley Cup that we'll put the winners on every year, and then they can house that in their office, and then they can have bragging rights for the entire year. So Chief, that's some incentive to bring in some ringers next year.
We even got our own ump and we still lost.
We didn't pay him enough, I guess.
They paid more.
Our cornhole tournament saw 30 participants. I believe that was a low number. And then we had the bingo and family games that we saw record numbers at. So that's always fun. Food and beverages, we had food trucks and vendors. There were 4 of our 6 food truck spots were full. 2 of them, one got in an accident a week or so before, and we weren't able to get that one filled. And then the other one had mechanical issues that wasn't able to attend. So unfortunately, we didn't have as many food trucks as we would like, but the food trucks did really well. Let's see. The community dinner cookout, we saw roughly 550 residents. In the past, we've typically seen about 300. This may be in along the lines of it was by donation instead of by fee, with $2,000 raised to go toward the food pantry for that. Let's see, Pancake in the Park, the police department, we appreciate their help, and they were back in the back mixing the pancake batter, mixing eggs, and Officer Nesson flipping the sausages. So that's something we would like to continue in the future, because that was a great partnership there. There were over 600 people served by the council and the police department, setting a new record for breakfast. So good job to everyone here for that. Budget, we were within our budget of $20,000. And let's see, 8,200 goes to bounce houses. Event and supplies takes around 5,500, 3,000 for the dinner and the breakfast, and then 2,200 to entertainment, 1,500 for advertising, for music licensing, for movie licensing, all that stuff. Revenue from vendor fees and sponsorships, we brought in about $6,500. The bounce house is bringing 4,000, and the community dinner was 2,000 for roughly $12,000 brought in. There was a significant amount of in-kind support from local businesses in the way of giveaways, items for all the different contests and everything we're able to do. And then the volunteer support that a lot of businesses come and they run specific events. Joey with CarQuest, Willie's CarQuest, comes and runs the car show for us. The Tremont Brigham Board of Realtors runs the Heyday 5K. Tanglewood Studios runs the baby contest. So without their
Youth Council.
the Ruth Council helps
They
us
did
with
a
the
lot,
bingo
yeah.
and the
Yep.
yeah. So without those volunteers, the Heydays would not be what it is. So we appreciate all the volunteers and all the donations and the sponsorships. Community engagement. So post-event reports, we had a staff meeting the following Monday after cleanup, and then we had another meeting yesterday with the populace of the volunteers. There was indicated 92% satisfaction rate among the attendees, and there was a lot of praise for the diverse activities and family-friendly atmosphere. There was also a lot of social media engagement within our event post and sharing and different things, as well as other Instagram and social and Facebook posts that were shared onto our page from people posting themselves. Some expressed concerns that were perceived and included from individuals. Not all attractions are free. We did talk about the bounce houses. It was brought up that why are the bounce houses not free? We started charging for bounce houses about 4 years ago. And at that time, it was very chaotic how it was ran. because there were so many people. So we did start charging. At first it was $12 with no lower options, and it was expressed that was way too high. We've dropped it down to the $10 per day, or $1 per ride if people don't want to be there for an extended period of time. We've received very little negative feedback, but more praise for controlling the chaos with there. So that is an option. I know it was brought up by a council member that they would like to see it free in the future, which a lot of places do offer free for that. My only expressed concern is controlling the chaos and safety measures. We do go with Checketts Amusements, who is bonded and licensed for with insurance to host these. We also hire their staff to man those bounce houses. So that's why the significant number, or how much the cost is because of we want the insurance and we want skilled people knowing how to do that. If we would like to make it free, we would lose that $4,000 revenue stream, as well as we would need to add probably 3 to 4 additional units to spread out the amount of people that we'd have. So just so you would have that would cost an additional $2,000 to $3,000. So just wanted to make that clear to the council. But it is an option that we can do, like, and be similar to other places. For the 5K, the route was not accessible to all abilities. Wheelchairs and strollers were not able to go through the gravel at the fairgrounds, so we're looking at ways to structure that, have a solid foundation for future with the turnover of the people that run that event. So there's a clear line on expectations for them, as well as a route that is available for all to participate. As mentioned a little bit, the goggle pit caused significant damage to the grass, but nothing that we can't handle. The women's restroom line was extremely long and difficult to clean during the evening hours of Saturday. So we will look at bringing in 4 portable units to be housed by the restrooms to help mitigate those issues. Also, the groove tables that we have in the food tent are the texture. It's impossible to keep clean during the fair time without a pressure washer, which we can't run during the event. So we'll look at purchasing 6 new smooth picnic tables for that. Enhanced lessons learned and recommendations. So enhanced promotion. We're looking at getting advertising out for more specific events at least 2 months in advance instead of the 1 month that typically has been the standard. Accessibility, we mentioned that a little bit, and adding a 1 mile to the 5K. Maintenance, bringing in the additional portable restrooms. Volunteers and community support. We want to continue to add more events and bringing more volunteers. So working with other businesses to bring in and add value to the event. And then outdoor comfort, adding shade and other cooling apparatuses throughout the park that we can, when we do get back to temperatures over 100 degrees, we can have a comfortable atmosphere for people to be in the park. So, yep. That's about it. So any questions from council? I know most of you were there. I think I saw everyone there at least part of the time. So we appreciate you being there and being out in the community and being open to people. So.
Hey, this is Brandon. Just a quick question. I mean, this is a major event for 2 days. I mean, there's so much going on. And you did mention the temperatures that are really unpredictable. I'm just wondering if there's ever been a discussion or an appetite about maybe scaling back and doing events in the latter part of the afternoon on Friday instead of doing things all day long on Friday and Saturday, just to save money and to make it more I don't know, more doable for your entire team. It does seem like we're offering a lot, and I don't have the history. I've only been in Tremont for 8 years, but sure, there's more people here that know more than I do, but I'm just wondering if that's ever been a discussion.
Did you see different groups at different events?
Yeah, every event brings in a different demographic. I feel if we scale back, we're taking away from the community togetherness that we're trying to bring together. Not saying that we can't, we can adjust things, but typically it's usually between the 1 to 4 time frame that people go home and rest and then come back for the evening. And we don't have a lot of things during that time that cost us much anyway. So I think most of the fees are already hard costs that are already there for other things. So we could look at it closer and try to pinpoint some of those things, Brandon, and come up with a plan that way.
Any other questions for Zach?
Good work.
Thanks, Zach. Appreciate it. Let's see, Chief, you want to take a minute?
All right, just have a couple things I just would kind of want the council's guidance on. We talked about tasers a while back, and we came and we wanted to do a presentation. You guys got kind of bogged down on the budget, understandably so. I would like to look within our budget and adjust some of our vehicle purchases to use some of that money towards taser purchases. Just for some context, I sent this in my department report, but the life expectancy or the usage time's around 5 years on those tasers, and most of ours are anywhere from 12 to 20 years old, 22 years old. So we're overdue. There's a significant amount of liability with that, with use of force. We've had a lot of failures at critical moments. The newest models shouldn't have that problem. They have multiple rounds, which would kind of defeat a lot of the issues we're seeing with them. I'm told we don't need to have a full presentation since it's within the budget. It's more of a nod by the council, but I guess Bill could illuminate that further. But if it's my budget and that's how we're managing, I see a far greater risk in having outdated equipment that's 20 years old. So my recommendation is we purchase that. We did get a bid. It's not terrible, and they've locked us into that rate from last year, but there is kind of a clock on it. So I'm happy to answer any questions you have as far as the differences or why this is a priority or anything for the council.
What is the cost?
What's the total cost we were looking at?
$128,000.
128,000. Yeah.
And this is for how many units?
25, I believe.
Yeah. And they are under warranty as well. They come with all the cartridges, things we need to operate with them. We've used the company for many years. It's kind of what every agency's using, so they are time tested. We've reached out to other agencies, and they highly recommend them as well. So.
And you would forego vehicle purchases?
Yeah, Skylar's kind of our vehicle guru, and he has a plan for that. Essentially, we would just cut, was it one vehicle you were looking at?
Yeah, so what estimates that I'm getting so far on the vehicles, I think we'll be able to cut one of them and get pretty close and then find the difference within our other budget lines that we've already got. So it'll be getting creative, moving a couple budget lines around. But
You had mentioned an officer in an altercation where they fired and they didn't work and there was an arm. Is that something that are our officers at risk right now?
Yeah, it's absolutely a safety issue. So the incident you're talking about, and I believe charges were filed on that. Are we good on that one?
Yeah.
Okay, so I can talk more about it, but essentially a male had a gun on him in a car. He stepped out of the vehicle as he's reaching for that gun. Officers were able to deploy a taser. It failed. Second officer was right there with him. He deployed a taser. It failed. Third officer arrived, deployed a taser. It failed. So as you can imagine, any one of those failures could have resulted in that individual getting that firearm out, and then we would have a dead cop today.
And this is just, when did this happen?
This was last year, yeah. So pretty recently. We are seeing more and more failures, and most agencies just aren't using the models we have anymore. They've just went on to the newer models as well. They're also not really under warranty. We've kind of just been taking more hand-me-downs to get us through. As one time's out, we'll buy a used one from another agency. I personally don't believe in that practice, and I feel like we're setting ourselves up for liability in the event something goes very badly. And we've been really lucky, and I'd rather be good than lucky.
Hey, Chief,
Yeah,
to clarify, we've been getting new tasers from the taser company, just the
old versions?
generations.
Okay,
Yeah,
thanks
so we're
for,
not buying a hand-me-down taser from another department. We've been buying those from Axon, which is who's the manufacturer of this new model. So
okay, I was misunderstood
we're
by
just a
that.
few generations
Behind.
on X26P and we're, I think, 3 back.
Good, thank you
I
for
think my
clarifying.
bigger concerns just with the adjustment are around in 5 years when we need the car, right? And now we're behind the ball on cars. Now we're going to be trying to catch back up on that. So this actually highlights to me one of the things I was going to talk about in our council reports is just a follow-up and I can't stress enough how important it is that we get our capital asset schedules laid out
Right.
over the next 5 to 10 years so that we're not caught off guard by anything, right? That we have a prioritization is very clear. And so those capital asset schedules are critical that we've just got to get those up to date in every department so that this doesn't happen, in the future.
Yeah, and I would love that. I'd love to know that our equipment's getting,
For sure.
recycled at the proper time. Part of my job is to protect the city from liability, and when I examine what's posing the biggest threat to us on that basis, it's the tasers right now over the vehicle. We run a vehicle longer, it's a lot less liability than having inferior equipment that has shown us that it fails time and time again. So that's why I'm
Had
bringing
any
it up.
recent failures with tasing?
I-
Has there been anything recent?
No, that's probably the most recent one. We're fortunate, we're able to de-escalate most of these incidents. So we're really good in that regard. I just don't want it to come to that and for this to be a different conversation. So,
But it's in your current budget that you can,
That
I
would
think
be
you
in the
should be able to do it.
fleet budget, yeah.
You know what you need worse than one to the next, and
Yeah,
sounds like that's a priority.
yeah, I appreciate it.
Chief, you mentioned liability. I'm wondering if there's also data and studies that show that by having this type of equipment, it reduces the overall liability for the city. If officers have these additional options, it seems like they're going to use their gun less often. And also, it seems like by having this equipment, you'd have less medical expenses for the officers themselves that are often hurt. This just seems like a better option to subdue individuals that need to be subdued. Any thoughts on that?
Yeah, no, I totally agree with you. We have integrated a policy where officers are required to carry a couple forms of less lethal. And again, our goal is to always de-escalate verbally, but sometimes you're dealing with people on drugs, alcohol, who just are not their self or having a mental episode, and sometimes it's the best possible solution. In my mind, we saved that individual's life that night because we continued to find other means, and even to the point where when the taser were failing, it stunned them enough that our guys went hands-on and ultimately saved their life, which is huge, but it really put their self in harm's way because at any moment that could have turned into a fatal shooting. So you're 100% right. I believe this would save us from a lot of liability. So I don't know what we need to do here, just.
well, it's in your budget and you're just going to make some adjustments within your budget.
Yeah, we'll find it within the budget.
Isn't there a, we discussed somewhere that if it's a purchase over $100,000, it needed to come to the city council.
Sure.
Otherwise, it's in your budget and you just move forward with your budget. Am I correct in reciting that?
Yeah, that's right. You're right.
Policy? Okay, so in this case where it's over 120, you'd really need to come back to the city council and get their approval to move forward.
Sure, and I'm happy to do that. I was just told that we could come get a head nod because it's in the budget. But if you guys want a full presentation or we want to talk about it further, or I could show you those videos, you'll see firsthand why this is a priority.
It's not a matter, Chief, of selling the council on the need for it. It sounds like they're all giving you a head nod that way, but they do need to ultimately approve the purchase for those.
Okay.
So,
Well, I did ask to be on the agenda. I guess there was just miscommunication. So we can try that for the next time then.
Thank you.
Cool. One other thing I want to talk about is the horse parade. So I have my opinions. I'm going to try to remove those from this unless the council asks, but I've done my research. I've reached out to our trust and our insurance company. The event carries a ton of liability, and I can't guarantee the safety of all the citizens participating or the riders. We're trying to figure out who's going to be liable in this event. If it does happen, I have talked to other agencies. An example is I talked to the Cache County Sheriff. They did have an incident. It ended up being a trampling with multiple injured, and they've disbanded their mounted posse, and they no longer allow any horses in any parade. I'm not a horse expert, but I can tell you what I've read through, the Utah Chief of Police Association and some other resources. We should have hard barricades to protect people from horses. The way it's being done, I don't think it's very safe because they've actually, it's anybody, all horses welcome. That's how it's being advertised. I don't know how many horses are going to be there. The biggest thing is who is going to take on that liability. So I've done a lot of reaching out. There's been some back and forth. Most recently, I did talk to the county attorney's civil attorney, and she essentially said that the best they'll do is they will sign a MOU with our city that splits it 50-50 on the liability. Personally, I don't think that's a great deal for the city. The other thing is when we had the original meeting, the county commissioner promised us the world, says you'll have as many people as you need. We got you. I'm told by the sheriff we'll have 5 deputies helping us. It's going to exhaust every resource in my department. I'm going to have to reach out to multiple departments around Box Elder County to staff this event. And that's not including all the barricades and things we have to do. So I just need guidance. Are we going to do this thing, assume 50% of that liability? And also, I have to validate that we'll be insured for this event, because when I originally spoke to our insurance, they said they don't even know if they'll insure us. So
Dustin is working on the MOU right now.
he is working on the MOU,
So,
but I did reach out to the county and I said, this MOU is coming, will you sign it? And they said no, unless it's going to be a 50-50 split on the liability. That's up to the city. But I don't, as a public safety professional, I don't feel comfortable with the event because I can't guarantee the safety of people. If I have a bunch of unknowns coming to this, I can't promise that a horse won't lose control. And I can only go on the best information I have, which is other more experienced horsemen and experts like the sheriff and Cache saying it was bad, a lot of people got hurt, we don't do it anymore.
What about the tire burnout and things like that? I mean, that's extremely dangerous.
Yeah.
And yet we still do that,
There's safety precautions. We put out those cement barriers and things like that, and it's a very short distance. There's rules. This one really doesn't have rules. I looked at some other cities that do this around the United States, and they put out a laundry list of rules for every rider. They know how many people are in attendance. You have to be approved. Your horse has to be approved. So we know only quality animals that are under control around crowds and noises are in that event. None of that's in place, and I only have.
a lot of these same people that would be participating in this would be people that are participating in the regular parade. We have lots of horses, in our regular parade. And, so lots of horses, lots of horse-drawn wagons and everything, along those lines. So I think what we need to do is let's look and see what this MOU looks like. And then, we want to make this safe for everybody. Sure, absolutely, we want to make this safe for everybody, but I also think that you're dealing with some folks that really do know their horses, and these aren't horses that are going to, dart and all of that kind of thing. And these people that are operating the horses and the wagons and that kind of thing are, they're as experienced as they come, so.
And I don't believe that's true. I actually had an officer who was asked to participate who just got a horse last year and started riding recently. He said no. but there are people that are amateurs that are interested in participating in this event.
Well, I think we need to address that. If we've got people that are, you know, you got, do you have like 4-H and FFA students and things? I don't know what you're.
I don't know who's
say
gonna
that.
be
I
there.
don't know what you're saying.
Yeah, that's the problem, Mayor. I don't know how many horses. It's, you show
I
up the
think it's
day
about
of.
40, is about 40.
Well, last time, what was the last number we heard?
So it was 40, but they're not gonna know till the day of.
Yeah, there's no prior registration. So like our regular parade, you have to sign up. We check to make sure you're a valid driver, your vehicle. There's all these rules. Your vehicle has to be in shape. The way we're doing this, it's kind of last minute.
But
and-
why are we making it okay for the, you know, for the regular parade? And where we have horses,
That's a great point. We probably shouldn't do it in the regular parade either. Now, that's up to the city. If you guys want to risk that 50% chance of a horse losing control and hurting people, I will do what you tell me to do. I will guarantee or do everything in our power to keep that route secure. I will keep cars out of that route. But if a horse loses control, we're not prepared enough to protect the public from that threat. And I wouldn't be doing my jobs if I didn't advise you on that. And if the city wants to move forward, we'll do everything in my power to keep you safe. But that's just part of the problem we have is I can't guarantee the safety. So obviously, as a public safety person, I'm going to recommend we don't do it, but it's up to the city if they want to do that. But one thing I do recommend is we clearly establish who's going to take on the liability. And if we're calling this a county event, they should take the liability. I don't think they will in talking with their attorneys. I think it's going to be split down the middle.
really doesn't make any sense to me, but
Mayor, if I may add one more thing, after looking at the route, it blocks off direct access to our only hospital in town. We would have to divert and go all the way around, even if it had nothing to do with, our ambulance call had nothing to do with the parade route. We would have to go all the way around if it were on this side of the parade route. And we're shutting down.
Tremont, is it Tremont Street?
The main street, we're shutting down for what, 4 hours?
Yeah.
And so if something, I can't guarantee that something won't happen in that 4 hours, and the way that it goes, something
Why
will,
would it
right?
be closed 4 hours?
That's the.
It really depends on how many horses show up, but to get out the amount of barricades we're gonna need for this route, and I sent you guys the PowerPoint, you'll be able to see that visually. We need a lot of time to set up, and also limited resources.
I guess my point is it's a box, and we could stage someone inside, but in order to get them out, we're gonna have to cross somewhere to get out to the hospital. And I can't guarantee where that is. So that's my concern with the route itself, is that it's cutting off our access, depending on where we're coming from, at least one direction, which is the main drag in and out of the hospital. It's coming down Main Street, and then it turns around and it goes right by the fairgrounds, which is directly down the road from the hospital. So that could potentially be an issue for the parade itself, having the ambulance come lights and sirens that way, and scare the animals that way too. Just to throw it out there.
But ultimately, it's up to you guys.
I'm not a horse guy, but I think it would kill us. I think we'd be hung if we stopped that. You stop the rodeo. I've been here my whole life. We've had a lot of horses. Once in a while, one gets away and runs down the parade route, but I think we're too far in the game to stop it myself. I think we're gonna have to take on what we take on.
Yeah, and then in the future, let's define it a
there
little.
will be a future. I mean, this is a once in 100-year thing. This
I
is
sure
a
hope so.
annual thing.
Yeah, I sure hope so.
I guess what I'm saying, if it's not, let's have,
Like the the contractor for the rodeo
Yeah.
would unload the horses, wild horses, at the crossroads and run them all the way down Main Street to the fairgrounds every year.
What was the population of the city when they did that? That's the difference. We're growing, more population, more people in danger. And it just takes one horse getting out of control, trampling 20 people. And that's coming from the Cache County Sheriff.
I hear you there, but I'm just saying, whatever you call it, politically or whatever, it's a,
Well, I guess to quote the insurance guy from the trust, he said, if one kid gets hurt, get out the checkbook. Because even if we're in the right, even if,
We'd do that on anything we do, the whole parade.
yeah, if it's worth the risk reward to the city, we'll do it. I mean, that's up to you guys. I just need
Throwing
guidance.
candy's probably
You
more of
wouldn't be
a,
doing your job if you were.
and I agree, I'm
the
just
risk.
saying,
Yeah.
from my aspect, that
Yeah, and I understand. There's other influences outside of public safety. All I can say is I can't guarantee it's gonna be safe. I'll do everything I can to keep the route safe. If a horse loses control, we're gonna put that on the county. We're gonna ask their mounted posse to try to intervene and hope for the best, but that's my concern.
But if they're doing 50-50 liability, then the sheriff's office needs to give you more people than 5 people.
I totally agree. We're getting a lot of volunteers and civilian staff, but that's kind of the problem. We need cars and trained staff to deal with some of the traffic issues.
Looks like the tasers are back on the table.
I guess another concern for me is, again, staffing for the fire department. Would you like me to have some more personnel on staff that day to run extra ambulances? Because like I said, I can put a box or some people inside that route, but they're stuck in there for that time being.
You're still gonna be able to get through.
And so-
You just gotta educate them on sirens and stuff.
Right.
Which,
And so my thought is
Never
we
been
could
to a
do it,
rodeo.
but we would have to have extra personnel come on like we would for a rodeo. If that's what you guys want, I can definitely put that out to have 2 more people on. And then we can do it that way as we do for the rodeo.
Our 2
And then
people
have a route
somewhere
where they
else.
would actually exit and enter and exit, depending on what happens in there, have a couple of different.
the whole fair brings 10,000 more people, 15,000 more people every day.
Okay.
So you about have to have more staff anyway.
Okay,
For the whole thing.
I'll send out a notice and get more staff, see if we can get some more people.
Yeah, so what I'm hearing from the council is we want to proceed. And
That's
if-
just my thing. I wouldn't vote to stop it myself.
It's not a vote, I just need guidance as we go forward. If we're okay eating 50% liability, we'll go for it. I'll continue the planning and then we'll wait for the MOU. So,
Well, these other
That should
guys,
be ready tomorrow.
okay.
these guys need to say,
I don't think Dustin's gonna I don't think he's writing it where it's a 50-50 split. They're not gonna sign it unless that's it, based on what I was told today by their attorney. So if we're okay eating that liability, then we'll go ahead and proceed, but I made my stance known and we'll back you guys up 100%. We'll do everything we can to keep people safe.
Thank you.
One last thing I will mention is we did meet with the Cache County Sheriff with the MRAP stuff. They do have a full team. I want to make sure our city's prepared for any kind of major emergency. Cache had a homicide and a shooting with over 1,000 rounds, I'm told, were shot during that event. In the event we have that, we don't really have, like, we have the Box Elder County Sheriff's Office that will come and help us. We also now have the Cache County Sheriff's Office. We're working on a mutual aid agreement. Basically, it's a written agreement that they'll come help us if something crazy happens. In exchange, we'll help them with what we can. So that's really good for our city. It's good for the future of our city. And we are putting things in motion to create long-term safety for the city as it grows. And we're going to try to meet with Logan as well. So,
Congrats on getting that in.
yeah, absolutely. Any questions for the police department? Cool.
Thank you for all you do.
Appreciate you guys.
All right. Thanks, everybody. I think we've got everybody. Lindsay, did you have anything for us? Okay. All right, let's see, council reports. Let's see, Brandon?
What was your question, sorry?
These are council reports. This is your chance to kind of tell us kind of what you're.
Oh, council reports. Oh, I don't think I have anything to add. Maybe someone else should have gone first and I know how to act.
Sorry, I should have done that. Well,
Yeah, so I already brought it up, but capital asset allocation schedules, we need to start working on those. And a priority matrix on, how we decide and a process behind that. So I don't know what's being done, Bill, there, but getting departments to start laying those out. What do you need from council to be able to get those moving forward? I don't want to get into January and be scrambling again. We need to start now.
Yeah, I agree
You know,
completely.
so-
It's actually something that we've discussed as department heads in the past, and we're working with Curtis to try to get something together that is more muchier and more clear.
Okay.
And so we'll get that to you just as soon as we can, and it's just a matter of working through where everyone is and getting those lists together of what capital they have and what kind of replacement schedule they have, and then, everything just kind of fills in the gaps after that.
All right, so yeah, that's just, I think we need to do that as soon as possible.
Agreed.
And because that context matters, right?
Yep, very much.
Everything we're doing. And then, yeah, that's all I have for now, due to time.
Is it 12,000 south that we're gonna do that, add the canal, make the road wider?
Yes, Rocket
Did
Road.
talk to somebody and this is somebody that talked to somebody that the power company's waiting for somebody to pay that bill. Who was supposed to pay the power to be moved? That's what
they're saying.
That's what they're saying.
My understanding was that we were waiting for them to do it. So if they're waiting for someone to pay, then we can find out.
Let me chime in on that. I happened to talk to Carl about that today, and he was gonna get with the power company. The local guy said that they did not have a request to start that, and I said, that request was in there a couple of years ago, when we
That was my understanding.
got all them right of ways and easements and all that. So Carl was gonna double check and then get back with me, and then I'll let everybody know.
They need somebody to pay for it. So I don't know if a developer's paying for it or we have to pay.
I thought the city has some sort of an agreement that,
I don't know. I'm
poles
gonna have
can
to
be
find out.
moved with, we just have an agreement that they'll do that for us, but.
That sounds
Not true.
less likely to me,
Oh.
but it sounds to me like there was some payment probably due, and whether it was the developer and they paid the city, or the city needs to pay whatever through impact fees or whatever, I don't know. I need to find out.
And I think that, don't we have the same thing over by the road they're waiting for, over by the grist mill?
Yeah.
That pole over there.
There's some poles there that need to be moved.
That would be a developer thing, I'm almost certain, but let me,
But I know that one, it's hearsay, like I said, somebody reputable talked to the power company and said they were waiting to pay. Now, whether,
well, everybody's always waiting for pay, right? I mean.
yeah, that's all I have.
But let me find out who's on the hook for that, and we'll get that going. I didn't know that. I thought they'd already been paid, and we were just waiting for their schedule to catch up. So let me find out more about that, and I'll let you know.
No, I've sent those strategies out to everyone. I haven't seen anyone respond back, so I'll just keep moving forward with what we have. And I'll meet with the department heads and get their input, and then we'll get together and roll them out if you want to.
Wes? Okay.
Okay, now I'm back on there. I just wanted to congratulate Zach on that little commendation that he got, well deserved. Thank you for everything. Heydays was a riot and all that as usual, and, we're gonna do everything we can to keep our public safety going, and Public Works sprinklers look great at the city office, and so, as usual, Sherry's gone, Michelle's stepped right in, and we just keep on trucking down the road, and I'm proud to be Tremonton citizen, as always.
All right.
I did think of something real quick, Mayor.
Okay.
I'm just a little concerned. It sounds like the school board's gonna pass this 30% increase. The board members I'm talking to, it seems like they're gonna vote for this, and I'm not saying it's right or wrong, but I am worried that this is a 30% increase on our citizens, and it seems like it's gonna make it really tough for any other future increases where we might have needs ourselves in the city. So I just see a storm brewing. So I'm nervous.
Thank you. Thank you for sharing that. Do you have anything else for us, Brandon?
Nope, that's it.
Okay. I just want to thank everybody. What I usually think is going to be a relatively short meeting turned out to be a full agenda. So I appreciate everybody and the hard work that you put into doing your jobs. It is a difficult thing and at times a very stressful thing, and so I appreciate each and every one of you so much. The only thing I just want to remind, toward the end of September, the date has not been set yet, but we will get that out as soon as possible, the open house. And this will be on Main Street, and we'll be able to discuss sort of the plan, what they've been able to put together, the Main Street Committee and Jeff and everybody else that's been involved with this. So I'm really looking forward to that. That's really all I think I have. So I'll turn the time at this point back over to Bill.
We just have a need for a closed session, I think.
You want to say anything before that?
No.
Okay,
I'll say it in the closed session.
okay. Time to, if you go into closed session, if we can do that.
I make a motion, we go in closed session.
I'll second.
Okay, motion by Blair and seconded by Bo. All in favor?
Aye.
Aye.
Aye. Closed session. Thanks, everybody. Thanks, everybody, for coming tonight.